Good afternoon, everybody. Welcome to our webinar today on outreach strategies for working with private well owners. Sally and Aaron, everything look and sound okay?
Yes, it does.
Thank you. All right, so we're at this Illinois State Water Survey at the University of Illinois, which we've been around since 1895, and I'll talk about that in a minute. But we run the private well class. It's sponsored, funded, and supported by RCAP, the Rural Community Assistance Partnership, through a grant from US EPA. And so we partner with RCAP. We kind of run the online side of things, and they do all the boots on the ground work around the country. And I'll talk about all of that as we move forward. But certainly it's a partnership that has worked well. We started the private well class in 2013. We feel very fortunate to have this program. So it's really part of this, as I mentioned, this national program. The materials kind of follow our free well owner course, which this is not the private well class. This is a webinar in support of that. And this is a specific webinar for professionals, mostly, really geared toward outreach strategies, things that we've learned along the way as we work with well owners all over the country. And so it is being recorded, and this will be available after we're done on YouTube. We have a YouTube channel. If you go to privatewellclass.org, you'll see the YouTube button at the top. And every webinar we've ever done is there. There's about 130 of them at this point, maybe a few more. And there's a lot of good information in those. As we go through today, you'll see that, you know, the back half of this webinar is mostly answering questions and talking about other resources that are available. Well, every webinar has a set of questions that you all asked on previous webinars as a participant. A lot of times those are different. And even going through those videos just to look at the questions is a really valuable way to learn about a lot of questions well owners have, as well as answers to things that you maybe even didn't think about asking for today. We will stay on and allow time for follow-up questions. So if you have a question today that's not something you submitted earlier, or we didn't answer every question we got, especially if a few of you just signed up maybe yesterday or Monday, those may not have made it into this. And so you can go to the question box, or if you have a chat box, Sally and Aaron are both on today. And we'll be adding those to a Google document that we all share, and I'll pull that up at the end and we'll try to go through those. As I say every month, we'll stay and answer questions as long as you all are interested. You know, this webinar is meant to be 2 hours, and hopefully we'll keep it close to that. Okay, so as far as these webinars are available for continuing education credit for environmental health professionals. We're an Illinois LEHP provider, as well as for NEHA, the National Environmental Health Association. And we haven't offered this particular webinar since June of 23, not quite 2 years. NEHA's credentialing cycle is 2 years long, depending on when you start that. So as an example, if your credentialing cycle just started this month, so it ended on 2/28/25, and you take this today, then if we offer the same webinar again, it wouldn't be available to you for CE credit through NEHA until after 3/1/27 if we offered after that date. What we'll provide is a certificate of attendance, a copy of the slide deck if you need it, and also we can work with you on completing the NEHA forms. Everything runs through info@privatewellclass.org, that email address. So that's where we ask that you submit a request. And to be clear, if you need a certificate, we're not going to generate one unless you ask for it. We're a small team. We have sometimes as many as 400 people on these webinars, and it doesn't make sense for us to go to that trouble. If you need a certificate, ask for it. And that's really that simple. And most of you who attend these regularly are familiar with that in the first place. One other thing, we used to offer partial credit. You know, this is completely free to you as a professional. And it's also, the idea is, you know, we're here to help you learn more about wells, not just to give you free CE credit. And so we don't offer partial credit anymore. So there's a couple examples there, but the point is really to learn more about well issues. There isn't any of us here, me included, that can't learn from the questions that get asked and the questions that we answer at the end. Some of those I have to ask others for advice to get answers. So every month I learn a little more just by trying to answer you all's questions, and it's worthwhile for everyone to participate in that. So anyway, enough said. I mentioned RCAP, the Rural Community Assistance Partnership. it's a group of 6 nonprofits that represent these regional areas. So we're in Illinois. The Great Lakes Community Action Partnership has staff, I think 5 or 6 staff just in Illinois alone. There's over 200 or 250 people around the country that work for RCAP. Some of those are dedicated for private well work that we do through this funding from EPA. So when you have an issue, or if you're a professional and you want to put on a workshop, they are a great partner. There's someone, Jesse Campbell is in Missouri and represents MAP, the Midwest Assistance Program. He travels all over that area and does workshops with folks in different states, either at local health districts or watershed districts or state drillers associations, all that sort of stuff. He can bring in speakers or be a speaker or be just a partner and help do some logistics. If you're really trying to reach well owners, RCAP should be a partner for you. It's really that simple, no matter what state you're in. They work also in Puerto Rico and like American Samoa and Virgin Islands and all those areas as well. So if you need a contact for any of these regions, you can certainly look on their website. You can also email us at info@privatewellclass.org. We work with these folks regularly because of our help center, where we get calls from well owners all over the country. We are regularly referring people to the regional RCAP person to either meet with them or answer a question or provide a resource that's more regional or local in their for their scope. So we're at the Illinois State Water Survey. I mentioned we're 130 years old. We started in 1895. So it's unique. If you're familiar with your state geological survey, every state has a state geological survey. I think that's still true. There's only 2 states that have a state water survey, and one is less than 30 years old, I believe. But the Illinois State Water Survey was founded in 1895 because of cholera and typhoid outbreaks and the concern about waterborne illness. And so our state legislature in Illinois started the water survey then, and now we're over 100 staff. We do a lot of applied service and research related to the entire water cycle. From the groundwater section, I'm a groundwater hydrologist, to our watershed science group, to chemistry, atmospheric sciences. We do work for FEMA for emergency response and for flooding. You name it, we're involved in it, and we help communities with water issues as well as private well owners in the state. We house the state's well logs. So in Illinois, the law says you have to get a permit from a county. We have 102 counties, a county health department. They submit their logs from all 102 counties to us. We're the repository, and we have about 480,000 well logs in our files, which represents just a little over half of the wells that we know exist in Illinois. So, and that's obviously a perspective. We also are fortunate actually to have that many logs. In some states, they have much less than half of the logs for wells that are actually in use, just because of the timing of their laws and things like that. So we have a long history. This is a typhoid example from, this goes from 1783 to 1910. The data was collected by the city of Quincy. One of our scientists put this together. I love to show this because I have a degree in engineering, and the work that went into just drawing this figure is impressive. Today, I think a lot of engineers would really struggle trying to draw something like this freehand or by hand and having it look this nice. But it really goes to show what happened when we started adding water treatment and how that affected typhoid and other diseases, waterborne disease. This is an example of a picture a water survey scientist took. He was taking a water sample from this hand pump. So in the late 20s, I believe, Illinois outlawed hand pumps like this on public, like in public parks. But before that, they were just there. You can see the little tin cup if you look closely at the end of the wood plank there. Everyone just came up and grabbed that cup and got some water out and took a drink and went on their way. Not sanitary. A lot of issues. These hand pumps, that's a piston pump with a check valve, so that water can sit stagnant for days. Natural groundwater, all kinds of bacterial problems. So I'm Steve Wilson. I'm a groundwater hydrologist. As I mentioned, I'm going to do the webinar today, or host it, if you will. So 3 of our water private well class staff, Katie Buckley, Sally Dolan, and Aaron Huggett have all helped with this webinar today. Sally and Aaron are here to answer questions. They also typically help with answering some of the questions you all ask. Like I said, sometimes we have to research those, and so we all help with all that work. And Katie's the person you'll be dealing with if you're trying to get CEs at the end or you need a certificate as well. Yeah. So today we're going to talk about outreach and outreach strategies. So really there's just a ton of challenges here. There just isn't a lot of funding, for one thing, for private well programs. When you look at even legislation, there's so many states that regulate septic systems and septic discharge. And so there's inspections at the local level, at a local health department or county health department on those things, but they don't necessarily regulate well construction or any kind of testing or anything for wells after they're in place. It is starting to change. We're seeing more funding being available, especially through CDC. There's some extension programs. Obviously, EPA funds us and the work that we do, which we're very fortunate. Again, we're one of the larger programs in the country, but we're able to reach all 50 states and provide advice through that and use local contacts for all that information. But it still remains a fact that, especially at the local level, a lot of times a county health department or a local health district may be writing a grant, like to CDC or to a state agency, trying to get funding just to do basic outreach and education to well owners. That isn't there. It's because the regs aren't necessarily strict, and they're different in some places by state, other places even by local health district. The rules can be different for private wells. And so those rules and construction code, permitting, I mentioned here New Jersey versus Pennsylvania. The bottom line there is New Jersey's been progressive. About 20 years ago, they passed a law that requires a water sample be collected. It used to be by the state lab. Now they contract some of that to private labs. But for a list of constituents that now even includes PFAS, it has to be done for a property sale. And only the buyer and the seller get the results. They publish the information on a grid, like a 2-mile or 4-mile grid, so that it doesn't affect an individual property that has a high value. It's up to the owner, the buyer, and the seller to decide who's going to remediate that if it needs it or if they're going to do anything. Versus Pennsylvania, which doesn't have well construction code, and it doesn't have a licensed driller program that evaluates their skill and ability. I'll say it that way. All of us on the call today can go on Pennsylvania DEP's website. We can all become licensed well drillers in Pennsylvania by paying a fee. But right on their website, it says having this license does not mean that you have any ability to actually drill a well. It's up to the homeowner who's putting the well in to evaluate the driller and ensure that they have the competency to do that work. So in essence, in Illinois and almost every other state, there's only 2 that don't have this rule. You have to have continuing education to be a driller. You have to pass an exam to be a driller. All those things. And so drillers, I just spoke at our Drillers Association meeting in February as one of the speakers, where they come to a meeting to get their continuing education credit so they can keep their drilling license. Pennsylvania requires none of that. So, and even when there are rules, enforcement really varies. It tends to be the low hanging fruit, or not, that's the wrong way to say it. It tends to be the least important thing, if you will, in a lot of cases, because there's so many other challenges, especially for health departments. If you look at what a health department has to deal with, food, even tattoos, right? Septic. I mean, there's just a ton of public health issues that they have to inspect every restaurant, all those sorts of things that sometimes private wells end up being left behind. And so, and even though they may have rules, I know there's one state where they're supposed to have someone go out, and for every well that's constructed, they go out to about 25% of them just because they don't have the funding and manpower. So it's just like here in Illinois, the water survey has several state mandates that we just don't do. And that's because they weren't passed with any funding and there is no one to do the work. And it's just that simple, and that's the way sometimes it works. So, but these differences, especially for us working all over the country, make it really difficult to be consistent, for one. And that's our biggest goal, is to create a set of outreach and education materials and provide advice that's consistent no matter where you live. Because one of the things we see is that lack of consistency leads to different advice for the same issue. And sometimes one's bad advice and one's maybe better advice. And so we try to find what we believe is the good advice and consistent advice. And that's the material we highlight and we try to provide to folks no matter where they're at in the country. So it's just like when, in Pennsylvania or in New Jersey, you have to get a water test if you're going to sell a property or if you're going to buy a property that has a well, a water well. Most states don't have that law, and so none of that is happening unless the buyer or the seller or maybe the bank or mortgage company require or choose to do that. So there's also not a lot of training for EHP, and the best example I can give, the one reason that we've become popular is, when we first started the private well class in 2013, we have an evaluation at the end of the 10 lesson class. And the way that works is you sign up for these lessons. They're sent to you as a PDF once a week over 10 weeks. So there's 10 lessons. And then at the end, we send you a link to evaluate our program. What'd you like? What didn't you like? What'd you learn? All that sort of stuff. And what we learned after the first year is nearly 25% of the people taking a private well class were environmental health professionals. And the information we got from the evaluations was two things. One, how do we get credit for this? We've addressed that need by working with NEHA. And two, why wasn't this here when I started my job? I was asked to inspect wells with no formal training and no real understanding of what private well issues are. So there isn't a lot out there, and especially in 2013 there wasn't. I'm happy to say there seems to be a lot more going on in the private well world as far as outreach, education, and research related to how to protect homeowners and the water quality and public health issues, which is great. We got in early, and now you look, especially like in journals, which I know most of you aren't involved in. I don't really do that a lot either, but there's a ton of private well research out there today. But when we did this, and I'm going to talk about a paper we did write in 2016, there was hardly any. And so we found a way to meet a need that way as well. So the other problem is that it leads to local approaches to how well owners are treated or how they're supported. So you may have a motivated person at a local health district who goes out and spends the extra time outside of probably their work hours to get funding, either from a state agency or from CDC or somebody like that, and they start a program. And it's great. Well owners are interested. They're starting to see the benefits of that and the questions they get, and more people are calling them and all that stuff. Well, then they leave or they move to a new job, even within their agency. There is no one else to pick that up. And if it wasn't for that person who was motivated on their own, who cared about this issue, then the program may die, or it may be a shell of what it was when it started. So having a consistent program and having consistent funding is really difficult. And it's really the only way to stay active and relevant with well owners. And so I know that makes this a little harder, but it's really how you need to look at developing a program working with private well owners, because they're not going away. There's always people who want to live out in a rural area or in the country, is the way I put it, who lived in town before, who has no idea. We're at the University of Illinois. We had a professor in finance call us. He moved from New York City to here to become a professor at the U of I. And 3 months in, he realized he had a well. How he didn't know that before, I have no idea, but he knew nothing about it, didn't know how it worked. And we got a call because he didn't have water that morning. That lack of understanding and knowledge is really what we're up against. And so there'll always be people in your area who have issues and needs. And so having someone with those skills is always relevant, especially for either a state, local, or county health department. Okay, so for today's webinar, why this is important, they're solely responsible for the well and drinking water. I got several questions about how do we protect well owners. They need to understand their responsibility. One way to put that is that they're basically the water operator for a very small water system. Like, a small community that has 350 people, if you're familiar with the whole small system issues related to meeting the Safe Drinking Water Act and having the resources to provide quality water to all the residents in your small rural community, then it's the same issue here. A private well owner is solely responsible, and they may not have the resources or understand that they should be socking a little money away for when their pump fails or for testing every year, all those sorts of things, and how to get that into everyone's thought process can be really difficult. And it's just that simple. And some people, I know there's a question about what about people who don't want to do anything. It's got to be their responsibility first, and making that clear that they could be affecting either their family or their other relatives who may visit them because they're not taking care of their water is really where this is at. Yeah, and again, most homes with private wells are never tested, certainly not regularly. That's the only way to know what's going on. And yeah, changing these attitudes is why we're here today and how we can reach those folks. So one of the things we did get funding, again, this is, I think, in 2014 from CDC, the Centers for Disease Control and Prevention, to evaluate why well owners don't test. Sounds like a simple question. It certainly wasn't. So we did two things. We surveyed other programs that do outreach and education related to private wells, and many of these were local scale type programs. And then we also did a literature review, which I'll talk about in a minute, regarding how to change behaviors and how to provide risk communication that's effective. And so we learned a heck of a lot by doing this work. The paper that we ended up writing, which I don't have to write research papers for my job. It's recommended, but I've written like 3 in the last 10 or 12 years, just because that's not where most of the folks we deal with are looking for information, right? If I asked everyone to raise their hand, how many of you have read a research journal in the last month? There'd only be a couple hands in my opinion, and that includes me, probably. Things get busy. So anyway, why this all matters is because our mission or our job or our concern as professionals in the water industry, no matter what it be, a driller, an EHP, or extension, or even a researcher, are public health protection and source water protection. And source water protection means protecting our aquifers and our groundwater. And obviously public health protection is about making sure the water that is being served coming out of a kitchen tap is safe to drink. So what I'm going to talk about today draws on a number of things. One is the survey I mentioned with funding from CDC. We ended up reaching out to 91 programs. We also went through all the health communication literature, and I sent one of my staff to go to 3 state well owner program workshops, one through Texas Extension, one through, I believe, Penn State Extension, and the third was might have been Virginia Tech Extension, where they have active statewide programs like the Texas Well Owner Network, and Penn State has a really progressive program as well for the state of Pennsylvania, which is great because of the lack of rules there, to learn. What do they do? How do they do it? What have they tried? We got a lot of great information from those folks who certainly know a lot more about all this than most of us, for sure. So, and then we used our own experiences here. Part of my job is to help well owners in Illinois. I use the well logs every week. We also have a lab that until 2008, so most of my career, which started in the 80s here, our lab offered free water testing for inorganics and metals to any homeowner in Illinois with a well. Now we moved from DNR as a state agency into the U of I as part of the Prairie Research Institute in 2008, and now that doesn't happen anymore, which was great for us when it was available, because since it was subsidized by the state, we could ask homeowners to collect 2 samples, one from their kitchen tap and one from an outside spigot that's been running for 20 minutes, so we get an actual groundwater sample. And as a groundwater scientist, who most of the research that I have done has been looking at source water, like arsenic in groundwater in Illinois, having that data was invaluable. But we have about 30,000 samples from private wells in Illinois, and we can look up in any area of the state what the water quality might look like, if there's any outliers, all that stuff. And you're starting to see more states. In another webinar, we talk about like Wisconsin has a really great online viewer where you can look by county or township at all the water quality on various constituents in the state. So, and so all these experiences together, along with other well professionals and educators we work with, and we work with a lot of people, which is, you know, I spend most of my time facilitating, but I also spend a lot of my time learning from others in other areas of the country. And all of that goes into what we're going to talk about today. So for the literature review, we were looking for three things: behavior change barriers, behavior change motivations, and risk communication best practices. And for those of you not in the public health world, behavior change is really what we're at. Any kind of advertising or outreach or education is trying to change someone's behavior, like why they haven't tested before. We're trying to convince them why it's important that they do that. And so what are the barriers to having them test? So along with several hundred research papers that we looked at, we ended up looking at this in general as health communication, including things related to smoking, teen pregnancy, nutrition, you name it. When it comes to working, especially in rural areas, what we figured out was that it doesn't have to be about private wells. It could be about what things work to convince folks to change their behavior. And so we looked at all of these different topics related to health. If we didn't have all of those to look at, we would have had 10 or 15 papers that really dealt with this in 2014. There just wasn't a lot out there. And that may be an exaggeration a little bit, but there just wasn't a lot of work on private wells that made it into the literature, 10 plus years ago. So, but what we did with that information, so in the end, I'll give you a link. We have all of this stuff in 4 PDFs, and it's all publicly available on our website. But we listed every reference we used, no matter what the topic, whether in the US or other countries, what things really just about how to create change for folks related to environmental issues or health issues. So what ended up from all that was this paper in the Journal of Water and Health. And we forgot to put it in the handouts today, but if you want a copy of this, and like all the tables I'm going to show in a minute are all part of this, the approach that we take, the 4 steps, all of that's part of this paper. But we have this available. It's now, it wasn't open access when we started, but after a few years, these become open access through the Journal of Water and Health, and we can provide, or you can look this up yourself, but it's about methods for conducting effective research to private homeowners. And again, this was based on a literature review. I think in the end, we used about 130 papers that we come across. We spent 9 months, or Lucinda Morris, who's the lead author, spent about 9 months putting a lot of this together. So the idea with the survey then, we funded by CDC, was to go out and pick the brain of all these other folks who have more experience than we did. What they did that was successful. They were trying to do outreach and education to homeowners with wells. Why were they successful? What did they learn? What would they do differently if they could start over? And we had a goal of 100 programs. We ended up with 91. It ended up that there were a ton of programs that all had free testing, either part of the time, like Groundwater Awareness Week, or maybe even year round. But we wanted to get a variety of types of programs, and so this is how we ended up. And originally the plan was to take a statistical look at all the common factors, but because this was fairly funded, there were some restrictions put on how we collected this data. And in the end, we weren't able to do it by phone. We had to use a survey tool online, and that really limited our ability to do a few things, especially statistically, just because there's no way to follow up and make sure people understood the questions correctly. Some of them dealt with the number of staff, and you're on the phone with someone. Well, is this a state-funded position, or does the county pay for this position? Are they 100% grant funding? We couldn't divvy any of that out or figure any of that out. And so we had such a range of values that came back that it didn't make sense to try to do any of that. So the best part of all this in the end was we asked people about their experiences and what they would do differently. We asked them to evaluate the program and how successful it was, whether it was extremely successful, very successful, marginally, or not successful. And we use that as our objective variable in the end to identify differences between how programs went about outreach, education, the number of methods they used, all that sort of stuff. So this is the approach we developed in the end. It's this 5-step process. You need to, first thing is to understand your audience, especially locally. It may be a specific issue. It may be that you're in a very rural area or actually in an urban area. We have both in Illinois with lots of wells. So how you approach those folks, maybe it's an older community versus a very new community with a lot of folks under 50. How you approach all of those matter because you're not going to reach them. If you're in a younger, more modern community, if you will, or you're trying to reach younger homeowners, if you're using the newspaper and ads on TV for the 10 o'clock news, you're going to miss them. That's not where they're at, right? So all of that sort of stuff. And then once you know your audience, then identify why is this a barrier for them? Are they too busy? Is there no money? Have they been neglected? Are they underserved? All those sorts of things. And then moving on, then once you understand those two things, you can develop motivations and strategies that are most likely to be beneficial and resonate with those folks. Or maybe it's around an issue. They're putting in a large hog confinement operation in a county here where it really got all the local homeowners up in arms, concerned about the aquifer. Or a few years ago, we had a hazardous waste landfill that was proposed for really nasty chemicals that was over top of one of our largest aquifers. Why someone would think that's a good place to do that, I have no idea. But it took a huge effort and a lot of mobilized local folks to identify why that should not happen. So it's that sort of effort. And once you've done all that, it's about building partnerships, both with other organizations that are in that area, people who can speak for you that maybe have more clout with the local audience, and as well as the audience. You got to be there for them, all that sort of stuff. And then lastly, it's about earning a trusting relationship. And unfortunately, the only way to do that is with time and effort. I'll give you some examples as we move through this, but you have to be credible and trustworthy. When someone calls you, even 2 years after your grant has ended, you need to try to help them. And if they know you're there, you can have this great program and have a great reputation, and they know people can count on you, and all of a sudden you're not there anymore and there's no one, and they call and they can't find anybody. Your health department or whatever organization is going to lose a lot of credibility with local well owners, and that spreads quickly if you don't find a way to maintain. So understand your audience. That's the first thing we're going to talk about. There is no one size fits all approach. It's really about understanding if it's urban or rural, the level of education you're dealing with. If there's been past experiences, you might be coming into I came into a situation where a local government entity had basically lied to a lot of the rural residents in an area. And so when they wanted to look for an alternate water supply, I was brought in through our research efforts to do an assessment of the aquifer on how big of a water supply could be put in there. Everyone distrusted me. I mean, everyone, because I was working for those two communities in their eyes, even though that's not our role. We're objective. That's why people ask us to do work. But it took honestly several years and a lot of conversations and meetings in order to even get a few people on board and to help us with our program. Contamination, obviously that's a mobilizing issue. When there's a spill or there's some kind of issue that happens, that gets everyone up in arms. And then again, young versus older, what kind of information they've been exposed to in the past. In some states, there's a lot of public health information available through a state health department, like in Minnesota. They're amazing, honestly. the information they provide. If you're in Minnesota, you don't know how lucky you are to have all the resources available to you at the state level on how to work with well owners and some of those things. I know I lean on them a lot. There's other states that really don't have those resources. It's not a priority. Maybe their state funding is really just in trouble. And so it's one of the first things to get cut is some of the education and outreach sort of efforts. And so knowing what well owners do understand, obviously, gives you a place to start. As far as understanding your audience, the real problem that I've learned is that they can be anyone. There is no demographic for a private well owner. They can be wealthy, they can be poor, they can be educated, or they can have a PhD or maybe a GED. They can be rural or urban. Some have been on a well their entire life and just assume it's safe. That would have been my dad. And others, could be brand new and just have no idea what they're getting into if they aren't. It could be an old dug well. So, and just for reference, I grew up on a small farm with an old hand dug well. My grandpa hand dug in 1933. It was only 14 foot deep and it was in a ravine. When it rained hard, we had cloudy water. So it was completely unsafe. And yet my dad, that's where he grew up too, always felt that our well water was better than city water, just because cities put chemicals in their water and that can't be good for you. Not understanding our well always had bacteria in it and could have had a lot of other things. And that's just the way it is. A lot of people grow up that way. But so it could be in a rural area like that or in a very urban setting. So those of you who know where Cook County is Chicago proper and a few of the very near suburbs. Cook County is one of about 8 counties considered part of the Chicago Metroplex. So it's the interior one closest to the lake. So it's completely urban, right? There's urban counties surrounding it. So, but what happens and what has happened is that many years ago when all these towns were growing and building, some of the city boundaries didn't match up. And there's these small pockets all throughout Cook County and, also Lake, DuPage, Will County surrounding Cook County that are still on private wells and septic because they're not they're not in the jurisdiction of any of those larger communities. And so what we have in Chicago, you can see Cook County here and how urban that looks. So we have a well viewer that's available through our state geological survey. All those blue dots and those numbers are depths of wells and water wells that are in Cook County. So the issues, so for one thing, there's 3,000 private wells in Cook County. And when I say that to people who are familiar with Illinois and the area, no one believes me. There's no way there's 3,000 private wells in use in Cook County. Well, yes, there are. It's just the way it is. And so, they're worried about things like well density because of these little pockets that are full of wells, spills, road salt. We see the shallow groundwater there becoming more salty because of road salt and chlorides are going up, as well as industrial issues. We had, 25 years ago, there was a company called Lockformer that had been leaking TCE for years and no one knew it. Originally, no one thought it was a big deal because everyone's on city water there, which is Lake Michigan. And it turned out that it contaminated a bunch of wells in some small subdivisions and folks started getting cancer and it was a real mess. And so there's a lot of different issues that you have if you're here versus I grew up near Middletown, Illinois. That little blue dot is where our hand dug well was. There's no record for it, but you can see the spacing here. This is basically a 4-mile square. Middletown, I went to New Holland Middletown High School, Middletown has about 350 people today. And so again, hand dug in 1933, it's only 14 foot deep. It's brick lined, uncemented brick all the way to the surface. Our issues were if we had livestock and in the summer when it was dry, that shallow well could go dry. We could run out of water. In the winter, we had a number of ice storms and snowstorms where we lost power. When I was 13, we lost power for a week. So, with an electric pump, no power means no water, right? And there's only 3 wells that are actually close to within a mile of our house, and there are other farms in the area. So I already mentioned my dad, so I won't say that again, but it's totally unsafe. And I didn't realize that until I left for college. And then all the bacteria and biota I had in my stomach that I was used to for growing up there for 18 years, when I was gone for 3 months and drank chlorinated water from the city of Champaign, and when I went back home, I could not drink our water without getting sick. So it is an issue, and people need to realize that. So I say media drives the boat because sometimes there's really poor information through the media. They're looking for a sensational story, and I've got a long career here, and I've been interviewed probably close to 100 times. And I can name 2 reporters who've ever given me a chance to even review the material they're going to publish, or that fact check things and made sure that everything was quoted correctly. So I've been misquoted many times, sometimes very frustratingly so. And so it not only is it a fact about a problem that I was misquoted, but the information they're providing is not accurate. So things like drought, flooding, nearby contamination, fracturing, lead issues. For all of us trying to reach well owners, they can be an opportunity. And I put public notice down here because for a community water supply, whenever they have a water main break, they have to send out a public notice saying that there's been a water main break. Everyone has to boil their water until further notice, and that gives them time to dig up that line and replace it and fix it. There shouldn't be an issue because water's always under pressure, so it's pushing water out. But it's so that if where that break is, if somehow water got sucked into that line that was natural groundwater, or from the water table, or from something else, that could contaminate the entire water supply. So they have to be safe, and that's the rule. That's the US EPA rule through the Safe Drinking Water Act, is you have to have a boil order until it's fixed, and you can show that there's no contamination issue. Some small town water operators have told me, a number of them, that whenever they issue a public notice and it goes out either through the radio or on television or whatever it might be, they get calls from local homeowners with wells that maybe live a half mile or a quarter mile out of town, asking if it's going to affect their well, not understanding what a boil order typically means and why they've given public notice. They're concerned that somehow the city's could contaminate their water supply. And that goes to the level of knowledge of the homeowner with the well. And it happens more frequently than we care to. I've got a ton of stories there. I had another water operator who said he got a call from a homeowner who said they didn't have any water. It turned out one side of the street was city water and there was a line. The other side of the street was all public or private wells. And when he went to the house, the well's right in the front yard, and knocked on the door, and they were like, well, we don't have any water. And the person didn't know that they were on a private well. So that's what we have to combat, is those sorts of things. And how we do that's really sometimes a tough nut to crack. So in our survey participants, 48 mentioned a local issue: disposal facilities, flooding, news reports of septic issues. You can see this fracking obviously is a big one around the country. Known arsenic in the area, LAFOs, we see that a lot. People just want to know, is this going to be a risk for me? One of the more common contamination questions we get is, my yard backs up to a farm field. Should I be worried about pesticides or ag chemicals? And the answer to that is, it depends. If your well's properly constructed, then it should be sealed at the surface, and that's not a risk. But it also depends on what type of well you have and how deep you're getting your water from. If your well's shallow, then it's more of a risk than if the aquifer. And there's places in Illinois where the aquifer in use is 1,200 feet below land surface and is protected with glacial clays for the upper 200 feet. Pesticides are never going to get in that well unless there's a breach in the well at the surface. So it really matters how to answer that question and to understand what the issues are. Where these really come into play for us is when something like this happens, it's a teachable moment. It's a chance to, when people have a heightened interest in protecting their water quality, and it's an opportunity then to do outreach and education. Like I said, these issues may change the direction of your program. Sometimes you may have an idea of what you want to try to do. As you reach out to homeowners and you start to implement that, you may know exactly what you want to do, but you may find out what's important to well owners is very different. And so the first thing is to understand what's important to them, because it will influence the direction of your program, and you have to be willing to do that. And if you're someone who's going to write a proposal, I would put that in every proposal I write, is that here's what we want to do and here's why, here's the issue. But we are engaging homeowners. First thing is to find out what's important and how that might help us tweak how we do our program. So if you meet their needs first, then one, they'll appreciate that and you'll be more accepted, and they'll know you care. And that's really what drives the train in the end. And you can always follow up with other efforts that you're more interested in later, once you've earned their trust and once you've shown that you're there for them, because they're doing you a service even by working with you in any way. If this happens to be a testing program or whatever it might be, for those things. So as far as identifying barriers, this is really a big issue. So there's a lot of reasons why people say they don't test, right? But understanding what those differences are depending on where you're at and what your local, your set of well owners, if it's a local study or not large in scale, matters. So we broke this down into 4 types of barriers. The first is knowledge barriers. Do they even know there's a risk? Hopefully they do. They understand that having a well means they probably need to test. They have to make sure the well's constructed properly. Some of the basic things that homeowners should know who have a well. And then one, do they feel that it's a threat? Even if they know they have an old dug well, my dad certainly did not feel like it was a threat and never would have as long as he lived. But how do we get that risk perception to them to help them understand why it's important and how simple it is? Your well water may be perfectly safe, but if you don't test, you don't know, and how to go about that. And then once you get into, these are further down the road, but is it convenient? There's a lot of stories out there where, especially if you want to deliver the sample or if you're trying to do something that's very time sensitive, the nearest lab to us now in Champaign, Illinois is in Peoria, which is 90 miles away. Well, if you have a job and you have to be there before 5, that's an inconvenience. And so are there ways to make that easier? There's a number of examples of some of those things as well. Things like Virginia Tech has done. They have a courier who goes around the state and picks up samples on different days and has a place for them so people can collect the sample that morning and it's at Virginia Tech by that night. And it's a great idea. They are able to do that because they do enough testing. And so all those things. And there's all these other reasons that you just, we're all human beings. We all have, sometimes, we look at why someone's concerned about something and you just scratch your head. Well, that's someone else who's looking at me, scratching their head about what bothers me sometimes. You just don't get how other people's brains work and what's important to them. So dealing with personal or social barriers are just as important in the end, because it may override whether they know it's the right thing or do or not. How many people have avoided going to the dentist when they know they need to, right? I mean, that's what we're talking about here. It's almost the same thing. Not going to the dentist or doctor because you're worried about what you're going to find out, or because it's going to cost a lot, or whatever some of those things are. And again, this is just a screenshot, but this is about barriers to behavior change. This is one of those 4 PDFs I mentioned. And so just listed here. So the way this is set up, if you download this after we're done, this is barriers 3 through 7. There's a description of what each one is, and then the sources they came from, which I showed that document earlier. And that's just a reference to whichever research paper that we pulled that it came from. So I highlighted here, as long as the water looks and tastes fine, they feel that testing is unnecessary. How many times have you heard that? My water looks great. It tastes great. Whatever. My first response to that is arsenic is odorless, colorless, and tasteless. And, we have a couple aquifers in Illinois where there's an abundance of it. And if you drink it over time, it's likely to increase your chances of getting cancer, period. It's just the way it is. And so that's why you test, because you can't go by taste. And many times the things that, that rotten egg smell drives you crazy. It's harmless. Iron is harmless. Red staining everywhere, or even, some of that reddy cloudy water. Those aren't the problem. The problem is you need to test for anything that might be a health issue, and you can't go by the way it tastes or smells to do that. Mass media often compounds the problem. I already talked about that, but a lot of times they do. They don't cover, instead of synthesizing the facts, so there's 42 of those. Water is not consumed. This is a question I get a lot more frequently than I ever thought I would, but it's actually a really important aspect to understand. We've had people from cancer researchers to you name it, treatment dealers want us to, do you know how many people use treatment or how many people don't drink their water? No one knows that. No, there is no database of that information. We had the New York Attorney General's office call us and ask us how many people in New York have treatment on their water systems. No, people in New York certainly do not know that. An individual treatment dealer may have an idea in their local area if they work with a lot of the homeowners, but that's just information not available. So when you try to do a research project or you're trying to look at instances of some disease or health issue, you can't just say, oh, well, this well water is known to have this. This is likely causing this problem, unless you've talked to every homeowner and you know whether they actually drink their water or not. A lot of well owners I've talked to are like, oh, we don't drink the water. We use it to brush our teeth and for bathing and our dishes and for the dishwasher or whatever, but we bring bottled water in. And I'm like, well, why do you do that? A lot of times they can't give me a reason other than they're worried about their well water. All they have to do is test, and then they know if their water's safe or not. And in many cases, it's going to be safe to drink, and it's just easier. It costs them so much more money to use bottled water than to use their well water, but it's the way it is. And most things aren't a problem except for drinking. They're not inhaled or absorbed through the skin. That's not true for a few things. Radon and Legionella both can be inhaled and be an issue. But if you're not drinking the water, then how do you know? A lot of times people don't know why. So they can also be hard to reach, as I mentioned earlier, because they come from every demographic. There's a number of reasons why they feel it is starting to change, but there's a lot of people who just, they believe groundwater is safe, or a well safe, it's coming from the ground, it's natural, it's all good. Human nature, again, I mentioned a dentist or doctor. Perceived cost, sometimes there actually is a cost, but like we tell homeowners, especially trying to sell a home, whether you're the buyer or the seller, it's better to know and be prepared and make a decision based on facts than not know and just assume. Sometimes the housing market, for instance, is so hot, if you will, that we've had homeowners call and go, well, if I don't put an offer in today, then I'm not going to get the house. And so my response to that is, I would test first. But if you choose to not do that and put an offer in with no idea of the well water quality, then you're doing that knowing that there's a chance you might have to add treatment to make your water safe, and it will have not only a front end cost, but also maintenance costs to keep that equipment running properly. So, there's just a lot of issues. Some people don't talk to us because they don't trust the government, no matter what, or you're a university egghead, which, just a lot of reasons why people aren't interested. And I know someone asked a question about hard to reach folks or people who don't care. There's a lot of people who do care. And some of those folks, when you work with them, word of mouth is really powerful. And eventually some of those folks will come around. Some never will. And, that's on them. That's all really the answer to that question. So Barb Luukkonen is retired from the University of Minnesota Extension, but her and a couple other folks from Minnesota, Wisconsin, and Michigan sent out 2,700 questionnaires to people in 6 counties, 2 from each state. And they did this as a social science experiment. They sent some with a $2 bill and a free water test coupon, some with just a $2 bill, some with just a coupon for a free test. And you can see from those numbers that When they offered both of those incentives, they had 72% response. When they offered just a $2 bill, 65, then 48, overall 64%. So that's not the important thing. The important thing is they asked people down the bottom right or left, how many are you? These are people who had not tested. How worried are you about possible health risks from untreated well water? Only 13% were worried. 87% were only slightly worried or not worried at all. And over half were just not worried with no understanding. So they gave them a laundry list of about, I don't know, 15 to 20 different reasons for not testing. And these are the top ones. So people could answer with more than one. So these numbers certainly don't add up to 100. But we've been drinking it for years. How many times, if you're in this game, that we're in, have you heard people say that? Or I don't know what to test for. There's all these reasons. The bottom one, I don't want to know. Somebody's just willing to drink water from their well and not want to know and not care. I mean, those are, what do you do there? I mean, I don't know how you reach some of those folks. I don't think you can. But I have an example of that. We were doing we were looking at arsenic in a rural area, and there's a rural subdivision where over about a 40-acre square, there were 23 homes. So we went door to door and asked about collecting a water sample. There's known arsenic in the area, and we wanted to look at the variability by distance. And so we have all these wells close together. It was a unique opportunity to see, because we see so much variability on arsenic concentration in wells that we were trying to get a handle on that. Well, one gentleman said, you can collect a sample if you do it when I'm not home and you don't send me the results. And we were collecting from outside spigots. So I chose to go ahead and sample his home. And it turned out it's because in Illinois, there's a law that requires you to fill out a form when you're selling your home. And one of the questions on that, which is legally binding, is do you know of anything adverse affecting your well or your septic system? And he wanted to be able to honestly answer that no, because he was going to try to sell his house. So you just don't understand necessarily people's motivations for why they do what they do, unless you really dig into the weeds, which is a very time-consuming process. So it's just, sometimes it floors you. Why wouldn't you want to know what you're drinking, right? Anyway, those four types of barriers, knowledge barriers, I didn't know what to test for. I don't know how to test. I didn't know I should test. I take that as on us, on me. If we haven't done a good enough job of reaching out to well owners and help them understand, the fact that 41% didn't know what to test for, it's partly on them as well, because you can look online and find a lot of advice. And part of that also is that you get different advice from different people. I mean, I can't tell you how many people have contacted me and said, well, my water was fine. What'd you test for? Coliform nitrate. Well, that's not a water test to understand your water quality. That's a water test to see if your well integrity is safe. It is not enough of a water sample. You need to test for inorganics and metals, and we're not going to go into that today, but that's in another webinar, which you can watch online or come to in the future. I don't know how to test. Well, there's a lot of things that have changed with this as well, because of some of the online things that are available that make it so much easier. We did this for some sampling we did. We mailed a kit to 60 homeowners, had the instructions in there, had a bag that you could freeze, the whole 9 yards with a return label. All they had to do was follow the directions, put the bag in the freezer overnight, and sample in the morning and take it to UPS. And so, some of those things we're working on. And I didn't know I should test. Well, that's changing hopefully as well. There's been a lot of activity in the last 10 or 12 years. And again, this is from 2009, but it's still relevant, especially in rural areas. But those are knowledge reasons. Risk perception, it's probably fine. We've been drinking it for years and I don't want to know. Well, drinking it for years doesn't really, you need to explain to folks that it's not acute, it's chronic. It's things that build up over time. The health standard for arsenic is based on drinking that water so many glasses a day for 40 years. You may think that's not a big deal, but if you could remove the arsenic and you're giving it to your kids, and you're putting them on a path that's not necessarily great for when they're adults, it isn't about drinking it for years because you don't see it as an acute problem that's going to make you get sick right away, unless it's bacteria, then you would. It's a perception of what really is risk and what isn't. Inconvenience, dealing with the problem would be costly, miss the testing program. The fact that whoever answered that way, they had a testing program, and this is in one of those 3 states probably, is a great thing. And the more opportunities we can give homeowners, the better off we are there. And then personal and social issues, I'll wait till others find problems. It's not something people talk about. Most of the wells where I grew up were hand-dug bored wells, hand-dug wells, brick-lined, a lot of them from before 1950. But nobody ever talked about getting sick or any of those issues. And we never realized when, my cousins would come to our house, and then 3 days later, we'd find out that, oh yeah, they got sick when they were at our house. How many times do you think it's because of the water? Oh no, we must have gave them something, right? There's been a bug going around. No one realizes that it's actually causing those problems. So, okay, so selecting motivations. These are the strategies, obviously, to create change. So we also made a list of all of these. And again, here's 3 through 6, techniques to motivate behavior change. So applied education, assessment worksheets, advertising, all that stuff. Teachable moments. So when there's an event or circumstance that make people more concerned, this is really an opportunity, whether it be flooding, discovering some contaminant, plume, worried about, a vulnerable aquifer that they found a lot of nitrate, whatever it might be. This is where you have an opportunity to really reach people and explain to them the importance of regular testing and why they need to test and why they need to understand how their well's constructed and where they're getting their water from. All those things that play into how risky it might be to be drinking their well water. As far as building partnerships, you need partners. When we met with all these folks who ran programs, the ones who's like, oh, we put it on our website, or we just went door to door ourselves. If you come there as a stranger and you don't have partners who are supporting it that people know and trust, both they won't support you and neither will your audience or your homeowners. It's really about making it a joint thing. And even if you have to alter what your plans are as far as how what you want to get out of this in the end to make partners more active and engaged, it will by far make your program more successful. It's just that simple. There's a lot of possible partners out there. I'll talk about a couple in questions at the end, but we've worked with all of these in different projects. And I realize that as a government entity, some may not be able to work with a business, but if you're trying to, they're a great partner, like a bank. Maybe they'll just donate money. Or here in where I'm at, our water company is a national traded corporation, American Water. They have research funding that you can write a proposal to get funding for doing outreach and education to schools or other groups, or to do small projects. You need to look into all that. Other groups like an environmental group may be willing to just be a partner by giving their time. There's a lot of ways that folks can help make your program stronger, build your reputation. Universities have tons of students a lot of times that are looking for summer work. I know we find out about students who their internship would be paid for. We just have to bring them in and utilize them. I know there's even a class on statistics that I can take all this data collected and just hand it to some statistics student, and they'll crunch all the numbers and do all the stuff that makes it, quote, statistically valid, so I don't have to, because that's something I just don't like or do very often. And so, but there's tons of groups, civic groups, your local Legion, and there's just tons of them, Eagles, you name it, Rotary. They're all available, and depending, agriculture, I know we work closely with our Farm Bureau and also with Extension, which is really university. But we recently did a webinar for our Illinois Soybean Association on another topic. But they're trusted. Farmers go to them. And so if they trust us, that gives us an in and maybe can turn a few more heads than we would have otherwise, as far as looking at what we do and maybe being supportive. So we asked all the participants in our study, which NVSP is not a very successful program, and ESP is extremely successful program. And this out of the 91, this is the average. I didn't put numbers on these because it's all over the map, but this is how they averaged out for based on, again, how they evaluated their own program. But obviously, the extremely successful programs all brought in more partners, and that's really the message here. And why? Because they share costs, they share effort, they help spread the word, and they can provide local buy-in. And that last one is probably the most important thing, and it's really worth doing those sorts of efforts to meet with folks locally, where they're at, and bring them in. So as far as risk and crisis communication best practices, again, it's the same sort of PDF. I've highlighted one here. Accept and involve the public as partners. Bringing stakeholders together can be costly up front, especially in time, or maybe you have to change your deliverables or change what your end product may be. But in the long run, it makes your program much more effective. It may give you even a quote test bed to go back to down the road. I know that's worked out for us and for me, where I've built those relationships. I know that we can go back to those folks. And one example is we did a lot of arsenic work, and we were asked by the Illinois EPA to give a presentation when the arsenic rule changed from 50 parts per billion down to 10 parts per billion by federal law in 2005. And so by working with mostly small communities, there were about 60 that their arsenic was somewhere between 10 and 50. We'd done some work looking at ways to remove arsenic that might not require a brand new treatment plant, which would be up to $1 million or so. And so we provided all that information. Well, then a few years later, we started a program where we needed to talk to small town operators. And so I was able to contact that same list of 60 gentlemen, or mostly gentlemen, and brought them to the U of I for a day to help us with solve a problem. And most of them came. I mean, we gave them lunch, and it's because they knew we were out there to help them before that made that happen. There's 98 of those. We're in a single session workshop right now, right? And so this is a good list of ideas for things that you can try in order to reach people. Some may resonate with you. It depends on the size of your program and how large of an area you're working in, some of those things. And the last thing then is earning a trusting relationship. Choosing the right messenger, being credible and trustworthy. There's a lot of ways to advertise. If you have the opportunity, you should use all of these. For our private well class, we've done almost every one of these. I'd say radio is the only one that we haven't done. So yeah, it's just because we're a national program. But they all work depending on the size of your area. Actually sending things through the mail, where we've had the most success with that is, physical mail is when we're working in a smaller area, in a rural area, maybe with a few zip codes. Postcards are pretty cheap compared to one first class stamp, and you can get a message out there that way. So when we looked at this, again, the not very successful programs said they averaged 3.8 different methods, where the exceptionally successful programs were 5.5. That seems pretty clear. There's an issue here, though, that it's about helping people understand the value. So the extremely successful programs all had a lower value than the other three types related to free testing, for the ones that did had free testing offered. And what we learned from talking to them is that it's about how you show that value. mean, when something's free, people tend to take it or leave it. Like these webinars. We have, I think we had nearly 400 people sign up for today, and there's 183 people on the webinar. That's because they can sign up and know it's not a big deal if they miss it. One, it's recorded. Two, well, there'll be one in a few months. And that's just the way it is. But if you can explain the value, especially for testing, then, or some other professional services, some of these weren't testing that we interviewed. They were things like they were mapping where wells are, or providing other kinds of advice for homeowners who maybe with well caps had problems, things like that. So it suggests that it's really about how to demonstrate the value is where the ones that did better at that were able to sell their free services better. So in the end, I mean, these are just some of the things that came up. You have to be engaged and committed, be willing to stay over time, openly work with partners to share cost, effort, success, provide buy-in, and what should also be listed there is being willing to alter your scope or tweak the direction your program is going to go in so that it's more beneficial to everyone and not just meeting your needs. Always try to identify well owner needs and the audience before you even start, because if you have some idea of where they might be headed, it'll help you tailor your message when you first meet with people. Like if you're going to have a public meeting to launch some program or to put on a workshop down the road where people can ask questions, all those things will matter. You need to be adaptable, change needs, as we mentioned, and then you have to be willing to stick around. And I say that a lot, but I know where we've really seen our program grow is because we've been around so long and people know they can trust us. And almost all the time, I won't say every time something hasn't slipped through the cracks, because we get a lot of requests, but we try to answer every single question we get. And so even if we have to go to other people to find an answer, or it may take a week or two to get an answer, I'll say balls in the air, juggling in the air. There's days or there's weeks where I'll have 6 or 7 emails out to others where I'm waiting for them to respond before I can, actually finalize some kind of response. And that's just how we've developed this program. And it makes a huge difference because we get asked to do a lot of things now, even by professionals, because they know that if there's any way we can do it, we'll be there to help. So again, our data is available. The last question on the survey was, is it okay if I share these answers publicly? 83 of the 91 said yes. And so we provided the 83 set of answers as a PDF. And it's also got the survey questions and the raw answers, which is a lot more detail there. Reading about what others have experienced, what they do differently. Some of those things would really help you if you're trying to start or you're running a program. In my opinion, it certainly helped us. And so, and then there's barriers, motivations, and communication best practices. So it's just at privatewellclass.org, our webpage /appendix. And just to show you, question 25 is, question 24, the 83rd group, whatever that might have been, they said their program was successful. Why did they say it was successful? Well, we didn't meet our goal of 250 surveys. We did attain valuable sampling records for the development. This is in Washington State, Yakima Valley. Our groundwater management area program. We've also learned through past efforts that once well owners are engaged, they're likely to promote the program with friends and neighbors. And that's very true. We find that time and time again. We'll get a call from someone because we helped their neighbor last year. That stuff happens all the time. And then the next question is what would you do differently. I think being consistent, slow and steady to build reputation, and advertising however you can to make well owners aware. Again, finding what motivates them and or is a barrier is a key. So this is that webpage. Again, it's privatewellclass.org/appendix. If you look on the bottom left, it says download Appendix A, which are the survey questions. Appendix B are the survey responses, and I'll warn you, that is a large PDF. And then C and D are the literature review summaries and the motivation, barriers, and best practices. The literature review summaries would just be is a summary of each of the papers that we used, and I can't remember how many there are of those in the end. but I know we looked at several hundred. I think it's over 100, but I don't remember for sure. But yeah, it's really useful, I think. And it'd been great if we could just publish all that information. We just haven't had the bandwidth to do so. And so this presentation is our close second. So I want to talk a little bit about the private well class. So if you're not familiar with the actual class, it's 10 lessons, it's self-paced, so you sign up online, and I'll show you that in a second. And then it sends you a PDF once a week for 10 weeks. Each one's about a different topic related to being a well owner. It's really geared towards well owners, but there's a lot of information that would be valuable to professionals as well. And so, like I said, a lot of EHPs especially take our class. And we actually have a version of this on NEHA's website that's free to take, and then each lesson is worth 1 CE through NEHA. I'm going to talk about that in a minute. So the webinars like today are support that, but they're really a chance for you all to ask questions. And that's why we do the webinars as well, and we do answer a lot of questions. And it's been really helpful even for us, because some questions we get every month. Other questions we may only see once in a blue moon. And so, our goal is to be there as a supportive entity for anyone, regardless. And then we do a lot of other things. These webinars, we have videos on specific topics and podcasts as well. It's really, the answer to what can a private well owner, what can I do to help a private well owner understand their well and well water. So this is our front page. I use this. There's 2 buttons at the top or in the middle there. Visit a help center. I'll talk about that in a minute. Or take our free class. Click on take our free class, and you can sign up for the actual class. We list our upcoming webinars, which again, I took this screenshot obviously sometime before January 30th, but it's pretty recent. And so this is what it looks like. The help center is a whole nother thing we just started last year with funding from EPA. They wanted us to build this, and it's actually turned out really well. So when you click on enroll in class, it takes you to this page and explains what you need to do. We ask for your first name, last name, email address, and location of state. And the reason the state question is there is really so that we can show the people that fund us that we're reaching folks all over the country. We actually had people from a number of different countries. Before we change this, now you only have a choice of the states and other, but yeah, and then you can click on which things you're interested in. We do also have a website that's called decentralizedwastewater.org that's meant to support the decentralized industry. It's not for homeowners necessarily. It lists like all the trainings that are available for pumpers, installers, and regulators, or most of them. And so that's just something else this is to send you a newsletter, or that information part at the bottom is. It's available in Spanish, claseprobosprivados.org, which I probably butchered that. But everything's done in Spanish here. We don't have the help center set up through that. That would be a major undertaking that we can't really do without funding. But we did redo the entire class in Spanish, including all the figures. So here's just one page out of that. We're fortunate being at the University of Illinois, which is a major research university, to have folks on Fulbright scholarships from other countries who are here. We found a young man who was getting his PhD in civil engineering from Columbia, and he actually felt it was a pet peeve. Some of the translators, when he did this work for us, were so poor that it made them hard to read if you're a native Spanish speaker. And so he redid this himself and did an amazing job. We're very fortunate. He's a really smart guy and really helpful. So, and saw the value in what we were doing for Spanish-speaking well owners in the States here. For each lesson, like the first lesson is called The Science of Groundwater, we list a number of resources. If you go to our resource library, you can get to these. There are other documents, mostly from state agencies or like extension and universities, that are meant to be helpful. So the Raymond Lyle documents from, I think it's from Cornell. These were done in 88 and 92, but they're great. They only use 3 colors, white, black, and blue. They describe how aquifers and water flows really well. If the lesson doesn't resonate with you that we wrote, these might, and that's why they're there. as well as there's a number of states that have well owner handbooks. We listed Minnesota's here, but Texas has one, and Texas is as well, but there's a number of states that have those. And then, groundwater and well construction, first one listed there is Michigan Flowing Well Handbook. There are flowing wells. Some people call those artesian wells. Artesian just means it's under pressure. We have a lot of artesian aquifers in Illinois where the water's not flowing out of the top of the well. It's just the water level's higher than the top of the aquifer. And so but Michigan has a real flowing well problem. They were losing 28 million gallons of water a day to wells that were uncapped. And so they passed a law that requires those to be capped and pressure fitted so that that water can't escape their aquifers. It's interesting. And if you happen to be in an area with a flowing well, there certainly are in a number of states. That's interesting information. These videos, as I mentioned, this is my Water Safe to Drinks, one of the webinars we normally do once or twice a year. This is from August 23. But it's just an example. You can get that from our webinars and events. Look at past webinars. These are also available full screen on YouTube. A few of the special ones we've done, like funding financing options for well owners. The last one we did was in 23. The Farm Bill gives the USDA funding to provide low interest loans and in some cases grants to low income folks around the country with wells. The Farm Bill was supposed to be out last fall, the new 5-year Farm Bill, and it still hasn't been passed. So we are holding off doing another webinar on funding and financing until after that becomes law, because there's changes to the private well part of that that expands who can get that money, what they can pay for, can even pay for treatment equipment, assuming it passes. So there's a lot of things that are rolled into the new Farm Bill that'll affect what's available to a homeowner with a well. And so, we need to do one. And we actually had USDA staff on this webinar. It's still a really good resource because it doesn't just talk about funding and financing for replacing a well. It also talks about, look at programs like Iowa's. Iowa has a Grants to Counties program where their state legislature gives funding to all the counties to provide or subsidize testing, well sealing for abandoned wells, other kinds of rehab work that's cost shared or maybe free to a homeowner in that county, depending on how much funding each county has. But no other state has a program like Iowa's. It's a really great program. And, there's some of those things you wouldn't know necessarily, even if you live in Iowa, about that program unless you heard it from somewhere. And then things like lead. We haven't redone this presentation, nor do we plan to. Everything you need to know about having an older home that may have lead or lead solder or galvanized pipes is in this. And we had a guest speaker for this, Dr. Kelsey Piper, who's now at Northeastern University. At the time she was at Virginia Tech, had done a lot of work looking at private wells and lead. A lot of, and especially in Virginia and North Carolina and some of those areas, a lot of the drop pipe for these wells, which is the line that brings the water up from the pump, were galvanized. And because their water is fairly low pH and fairly corrosive, they're seeing a lot of lead in homes on private wells, just because of the time it sits in the column pipe and can leach lead out of the pipe itself. So yeah, like I said, everything here. And we also have, I think I show it here. Yeah, if you just do privatewellclass.org/lead, this page will come up and it talks about, there are ways to remove lead, especially at your drinking water tap in your, like your kitchen faucet. Those point of use systems are really good for removing lead, and some of that information is here. And certified products listed for lead from the National Sanitation Foundation, all that sort of information. And for any of these things, you can also email us or call us, and we may have to look some stuff up or whatever, but we can help. That's the bottom line. Not with funding per se, but with the information you need. We also have a series of these training videos. I think there's 22 or 23 of them now, but just on an individual topic. What should I know about a shared private well? It's amazing to me how many wells are actually shared around the country. If you don't have an agreement in place, maybe the physical well is going to be on one person's property. And if you don't have any kind of agreement, that person decides to sell their property, or maybe you have a falling out with that person, then they may decide that you can't use their well anymore. And so there's actually tons of issues that we come across related to shared wells, water pressure, having enough water, who pays for things whenever there's a problem. All that needs to be upfront. If it's not in your deed or in some kind of contractual agreement, it should be. Our most popular video is not necessarily this one, but it's about pressure tanks and how they work. Over 400,000 hits. Basically, a lot of people we realize have pressure issues. Maybe it's just on the second floor, because it's got to lift it so much higher. This is all about the settings on your pressure tank. Some of that's going away because of the new types of system that use variable speed pumps, so that the pump is actually applying the pressure. You may have a 1 gallon or a 2 gallon pressure tank instead of a traditional large one, like is in this example. But older homes especially are probably still the old system. And whether your tank's not sized properly or whether the pressure's not set correctly, for the on and off pressure, all those things, we explain all that. We have a podcast, it's called Tap Talk. I meant to put the URL on this page. It's drinkingwaterpodcast.org. And it's really a combination of all the programs we run. We have 3 programs. One's for water and wastewater operators at community water systems called wateroperator.org. I mentioned earlier decentralizedwastewater.org, which is for the on-site community, on-site wastewater community, and then our private well class. So these are 4 of the speakers we've had or interviewees we've had related to private wells. Brian Swistock was at Penn State. I learned a lot from him before he retired. It was really lost to our industry when he did. Alan Wolf Dr. Wolf is the head of pediatrics at Boston Children's Hospital, and he talks about some of the cases he's run across with unique pediatric problems with patients that ended up being a private well issue. So there's a number of those. We've about to complete our 5th season. There are 12 in a season, and I think 48 have been released. There's 2 more coming that are related about financing for community water systems, but there's a number of these related to private wells, including Barb Luukkonen, who did the survey. We had her as one of our first guests. So if you go all the way back to the beginning, you can find the conversation we had with Barb, which was great. She's really fun to talk to and really passionate about what she does. So in the end, the goal of our program for well owners is really to help them understand why their well is important, why they need to understand how it works, and also then how they can protect themselves from risk. And so if we can accomplish even any of that through them taking our class and calling us and asking questions, then that's great. I think our goal in the end is, there's a line that's a bar basically where well owner knowledge is today. And if we can even inch that up a little bit overall around the country, then we've done a great service, in my opinion, to help people understand how they can take care of and manage their well themselves, which is really their responsibility as a private well owner. So more for professionals, which is, this presentation is really geared towards professionals, more so than well owners, just because it's about how to do outreach and some of those things. So we have a version of the private well class. I mentioned, I need to take a drink, excuse me. For sanitarians and actually for home inspectors, ISHI, on their website, you have to sign up. If you're not a NEHA member, you have to create an account, but you do not have to be a member to take this. It just gives you a certificate. For each of the 10 lessons, there are a set of questions you have to answer and pass, I think 70% in order to get that credit, which is different from what we do for homeowners. There's no testing per se. We do have a pre-test and a post-test that we ask everyone to take, just because that helps us understand if you've learned anything by going through the 10 lessons. But there are quiz questions at the end of each of those 10 lessons on NEHA's website, and I'll go over that in a second. I mentioned hosting workshops around the country by RCAP regional staff. They can either host a workshop on your behalf and work with you to advertise that in your local area. They can come to a state meeting if you run, any of those. I know At least one of my staff talks at almost every Illinois Environmental Health Association event, whether that be their virtual workshop, their Southern group, or their state group. And we're glad to do it because it's an opportunity. We work with the counties anyway through our well records and other things in Illinois. And so it just helps build those relationships so that, if they run into a problem that they can't answer, they can call us, or sometimes we're calling them on behalf of a well owner at a county level then to get them some help. We also developed an assessment tool. It's kind of like a sanitary survey, if you're familiar with those, but it's a tool to evaluate the risk and vulnerability of a well. This says soon we'll have a guide. The guide is out. I forgot to change that. There is a tablet version, but that's going away, mainly because when we first built this, Android and Apple tablets were the thing, and PDFs, the science of how PDFs are developed through Adobe wasn't that great. That's all changed. And so now there's a fillable PDF that you could even fill out on your phone, but it's meant to be a fillable PDF that has drop downs and all those things for this assessment tool. And we do have a partners page, which if you are a professional, we certainly suggest you take a look and sign up for a monthly newsletter. It's got a lot of good information in it every month. And like when we're going to have our private well conference. We haven't had a national private well conference since 2019, but we're having one this May. And I'll talk about that in a second too. So this is just where you can click on information on the enroll in class if you're an environmental health professionals and you want to go through NEHA's website. This is what that looks like once I have an account, I'm a member, but once you get in there, it shows it's free. You just have to add it to your cart, sign in. If you haven't joined, this is how you join. You just have to have an account. Again, you don't have to pay anything. You just, through NEHA, you need to have an account to get into their e-learning center. So as far as partner resources, this is that page. If you look under resource library, that might have changed. Hang on one second. We might list newsletters directly. Oh no, we don't. Okay. So you sign up here after clicking on the button, take our free class. This is an older version, but below that is our newsletters that go out every month. As you do go through that at the bottom, and then, this goes back, looks like our newsletters go back to January 2016. There's some other materials there that you can download. I'm going to talk more about the trifold that's shown there, but there's also this form that needs updated there. Just realized that says 47 million, it should say 58. This is our newsletter. This is an older one. I show this because this was an abandoned well that was in a town in Western Illinois, 4 blocks from downtown. It's a town of 30,000 people. They've had public water since 1916, and so is this house. And someone bought this property and realized that concrete slab with a little 3-inch hole in it was where there'd been a hand pump. And when they figured out this is an old dug well. So they got a hold of the geology department at Western Illinois University, who contacted us. We all worked together to make this a field demonstration for the county, our environmental health professionals at our county health departments in the area. So the gentleman who's pouring the bentonite there is with Diedrich Well Drilling. And so, Gingrich Well Drilling, I'm sorry. But anyway, they volunteered their time and the bentonite. We volunteered the gravel. We also videoed this whole thing on how to seal an abandoned well in Illinois. And again, that's going to vary state by state because of your state well construction code and what the rules are for abandoning wells. But in this case, this is a 22-foot hand dug well. You can see how it kind of looks flat, the bricks do on the side of the house. That's because of that open well, the foundation's starting to push out. And so sealing this became really important when we realized that. And that's the kind of thing that can happen, right? The other thing about this was the person who lived there before for many years saw that little 3-inch hole, which we found half the hand pump, the drop pipe for the hand pump in the well where it rusted off. There were about 10,000 or more cigarette butts down the bottom of that 22-foot well, which was dry, as well as 4 or 5 lighters. And so that person felt like that made a great disposal for his, he obviously went outside to smoke. Yeah, I mean, you just never know what you're going to find when you open a well, and that's a true statement. So, but this is our newsletter, and so you can find that older newsletter has this video. You can also find it on our webpage. Here's Septic Smart every year is something that US EPA puts on. We help as much as we can with that. We are a partner with US EPA. We participate in their Septic Smart program. If you are inclined and manage a program, or you work with septic systems, we're in the septic system side of things with the private well class because of their potential effect on water quality in a well. But we also understand that it is a potential source of contamination, and everyone needs to maintain and take care of their septic systems properly. So there's a lot of good resources there. Proclamations you can get like from mayors or governors, all those sorts of things if you go to the EPA's webpage on that. And then I mentioned our well assessment and the fillable PDF. So what we did is brought together a group of 12 experts, some state agency people, county health department folks, a couple drillers, and a couple hydrogeologists, or groundwater hydrologists. And we put this tool together. It's got 18 sections on, it's something that you can go out in the field and work with a homeowner directly. And then you can fill this out, and in the end, you can make recommendations. Some of the recommendations are what you'd want to recommend to every homeowner, like why you should sample for coliform and nitrate annually. But it's a good way to look at it. Asks about their piping, if they happen to have copper pipes with lead solder, find out what year their house was built, all that sort of stuff. RCAP is doing these assessments, the 6 regions. Actually, there's a couple states where the health department, when they get a problem well, they'll call RCAP and ask them to do an assessment for the state. It's all free to the homeowner. And maybe 4 years ago, they added that they'll also collect a free water sample for most of these. I'm not sure if it's for all. They do like 600 a year now. And I think it's something like that. It might be 450 a year overall. But anyway, it's a great opportunity if you're a homeowner to have someone with a lot of knowledge come out and walk you through all the pieces of this. Things like backflow devices on your outside spigots. Most people would go, well, what's that, right? And you can explain why they're important, especially if you're a farmer who puts a hose in a tank to mix his pesticides, some of those sorts of things. And so it's really a useful tool. You do have to have a fair amount of wherewithal as a private well expert to fill this out for the homeowner, but it's really worthwhile. And one of the things we did, there's 540 separate elements in this PDF. And so, well, I'm gonna skip that part for a second. I think it's coming up, but it's like a sanitary survey, as I mentioned, and it's a great opportunity to educate homeowners with wells. That's really why we developed it, because you can walk through all these things, and hopefully the homeowner is asking you questions like, well, why do you need to know about that? And you can explain why. It helps you promote best practices, and it encourages communication. And I say that because we have so many homeowners who contact us and like, well, I don't want to call my county or my local health district because what if they tell me I can't drink my water? There may be a few local jurisdictions where that could be the case, but in 99% of the country, they don't have that authority. You can always ask them if they have that authority or not, but they're there to protect your public health, and they want to support you. And so that's what I tell well owners, is that you should rely on your local health district or your county health department. If they don't know an answer, they can talk to their state or other experts that they do know and get you the help you need. And they're, someone that all homeowners and well owners should rely on. We did develop a guide, which is where I was headed a second ago. I thought it was the next slide. There's 540 elements, as I mentioned. So we made this guide that says, here's what you really need to do. Before you even go out to the home, you should see if there's a well log. If it's a state that has those on file or has them online, more and more states are doing that. Things you should do if you're the assessor, take pictures, like what RCAP provides back to the homeowners, not just a filled out assessment, but also their well log, maybe their septic information if it's available through the state or a local jurisdiction, the pictures they took, and then a set of advice on here's what you need to consider Here's where we see that there might be a risk or vulnerability. And we even ask if how close they are to a public water supply, because for every well owner, I mean, there's some well owners that really have a lot of wherewithal and can take care of their well. They understand what they're doing to add treatment. They maintain their treatment equipment, do all the things right. But we also run into folks who have none of those skills and have no idea what they're doing. And if there's any chance that they could hook up to a public water supply, we encourage them to do so. Just because they're not going to be able to manage any kind of treatment equipment, they're not willing to pay for testing, all those sorts of things. And sometimes it's right across the road. We had a case where one of my colleagues at Extension here was buying a home out in the country that was very near town. And we know the shallow aquifer there is high in arsenic. So I recommended that they have the well tested, and they did, and it had 72 ppb of arsenic, which the standard is 10 for a public water supply. There is no standard for a private well. If you want to drink water with 72 ppb of arsenic, you certainly can. We don't recommend it, but you can. So they did that, and so they called me back and said, yeah, we tested, it's high. They're a young couple. They were gonna think about having kids. So where their house is, I was like, there's a subdivision right there. Are you sure there's not city water? So they contacted the community water supply, and it turned out there was a line right across the road. So it cost them like $6,000, which is a lot, to run a line under the road and hook up to city water. But their option was to add arsenic treatment, which they'd still have to test to make sure the equipment was working well. They'd have to be sure and maintain it according to the manufacturer's recommended maintenance schedule so that it actually worked, because one of the biggest problems with treatment equipment is when it's not maintained correctly, especially like a filter, it can become the source of contamination, especially bacterial contamination, because there's all this food there that's being trapped by the filter, and bugs love that and can start growing on it. So to them, it was, that's a decision they made, and they could afford it. I think it was by far the best decision they could ever make, because a public water supply has someone who's sampling the water regularly, has a licensed water operator that makes sure the system is always got pressure and all those things. It's a much safer supply overall. And again, I say that if you don't have the wherewithal. I certainly am pro driller and all those things. I'm a member of the National Groundwater Association, but there's some people who really just shouldn't be on a well. And in that case, if they have that opportunity, it's certainly a great opportunity. So we've also then later, just recently, developed an on-site wastewater treatment system assessment. So basically a septic assessment, that's its own entity, if you will, not just a section like was in our private well assessment, has a small section like the size of section 7 on this image. It only asked a few questions, but now we have a full-blown assessment. We worked with NAWR, the National On-Site Wastewater Recycling Association, and experts at RCAP who do wastewater work every day to develop this tool for on-site wastewater treatment systems. It's being piloted by the RCAP staff around the country. They have about another year and a half to complete. I think it's 140 of these. Once that's done, it'll probably be written into our future grants for RCAP to go out and do more of these. It's good to understand your on-site system, whether it's a simple septic system and tanks and a drain field, or if it's more advanced and has treatment added to it, and you're chlorinating or removing BOD or nitrate or whatever. But it's really worthwhile. And again, this will all be free to the homeowner. It's free to everyone. It's just a time an RCAP person needs to come out and do that. And I didn't mention this earlier, but both of these tools are also on our website. You can find them under assessment. I think it's /assessment, or reach out to us. They're downloadable PDFs. They're free to use. I know there's a group in Massachusetts working with RCAP Solutions that through the Health Foundation of Central Massachusetts, they sampled, I can't remember, I want to say 240 homes, and they may do an assessment part of that work. That wasn't related to anything we do. It was them taking our tool and using it for the betterment of those 240 homeowners. And so if you're that inclined, I encourage you to consider using it when you're working with well owners, because it's a great tool. It's no stone unturned. We do not have a guide for this, and the piloting is being done because we know with the well assessment tool, we had 7 or 8 iterations of that as the RCAP folks went out in the field and we went out in the field and we're using this on wells. We learned that there's things we missed, things we should have added, things that need to be worded differently, all that sort of stuff. Just for instance, I learned that in Illinois, it's legal to have a lagoon for your home wastewater system. You don't have to have a septic tank or whatever. It can be a lagoon. There's a few states that allow that. Illinois is one of them. I think Nebraska and Oklahoma are 2 others. You know, I learned that from one of the extension folks in Nebraska and found out Illinois does too, from one of our county health departments. So we're all learning all the time. That's kind of that message, I guess. And so we had our first national conference in 2017. It was in Champaign. About 120 people came from 30 states. It went really well. It's 3 days. 2.5 days, and we had 26 talks, including a drillers panel. We brought in 3 drillers, 1 from Illinois, 1 from Minnesota, I think, and 1 from Iowa. And they talked about some of the issues. It gave the health folks and the drillers a chance to talk to each other, which I think is important because in a lot of states, it's the health department people that are regulating the driller. And so that can make for a tenuous relationship in some cases. And so we've had that every time. We had another in-person conference in 2019 in Pennsylvania. And since then, we've had 2 virtual conferences, which, you know, they got the job done, but it's not the same as being in person where you can make connections. For instance, at the 2017 conference, the one thing I hold my hat on is this was in May of 2017. Folks from Virginia Tech met extension folks from Texas and Florida. 2 months later, we had 2 gigantic hurricanes. The Virginia Tech person was able to reach out to the people they'd met from those 2 states, and together they wrote a rapid grant to NSF, and they sampled 1,500 homes that had been flooded by the hurricanes in Florida and Texas. And that would have not happened as fluently and quickly had they not met at our conference. And so that's the kind of, you know, hopefully synergy we're building. It's not a research conference. It's not about the latest research findings. We try to bring in people who've done practical work, or if they're doing research, it's got to be more things that have a product that would be relatable to a driller or a health department, more not theoretical research, but applied, because that's what we do. We're not, I'm a researcher, but I don't do strict research. It's really applied work, trying to solve today's problems, if you will. And so that's who will be at our conference in May. It's going to be in Bloomington, Illinois, just because we haven't had one in 6 years. We will have one next year as well in May of 26, and we haven't decided where yet. It'll be somewhere else besides Illinois. But if you want information on that, it's privatewellclass.org/conference. We can hold about 150 people. Yeah, and the registration for that hasn't opened because we're still finalizing the agenda, but we hope to launch that on Friday. And again, we'll send that out to everyone on our newsletter list and try to put it through all our social media channels. But if you're interested, send us an email also, and we can make sure that you get notice of that. Barb was our first speaker. Her study is unique. We've not seen one like that in the country. 2,690 people got surveys and all the things they found. You know, they got all these $2 bills and they had to iron them. So that was it was a funny slide that day, but we record every talk and they're available on our YouTube channel. So if you can't afford to come to the conference or don't have travel money to come to Bloomington, Illinois, know that by the end of the year, all 26 presentations and the drillers panel and our lightning talks and all that stuff will all be available on our website. The idea here is we understand that local health districts and county health departments typically don't have travel money. And so to bring somebody to Bloomington for 3 or 4 days is kind of a financial burden. And if you don't have those funds set aside, you can still watch every talk. And if you've not heard of our conference and you've not watched any of these, I encourage you to go back to the 2017 conference and start there. A lot of really good information about things like grout, you know, why people don't test, a lot of the Be Well Informed tool that New Hampshire developed with funding from CDC is an amazing tool. All that was talked about in 2017. 2019 we went to Pennsylvania, partly because they don't have those rules. And our first speaker was Todd Giddings, who's a hydrologist who helped write a local ordinance requiring well drillers to have, I believe it was NGWA's Master Well Driller certification. But yeah, it's an interesting thing that they're taking it in their own hands because the state won't step up and create some of those rules that really are needed. So this is a trifold brochure. We came up with this idea, or one of my staff did, it wasn't me, that we should develop a brochure that we can give out to like a county health department or a driller or anyone, where they can just put it in their office. People can pick it up if they want it. It lists, it's just, is my well water safe? And so we developed this, I don't know, 5 years ago or so. I know we've had to revise it once. There's 23 million American households, that's 58 million people. But on the inside, it says why you should get your well tested. Here's some best practices you should follow. And then there's this free class available to you. You just have to sign up. No, there's no expectation. It's self-paced. It's, our private well class. So we offer this, and there's a call out right now. We'll send these to you for free. We've printed 93,000 so far. We've had 5 printings. We're about to do our 6th printing, and it's all based on people requesting them. So if you're interested, we've had one state lab who asked for 3,000 of these, which we gave them. They put it in every sample result they send back to their private well owners who've tested. And again, this is the state lab, state agency, not some private lab. But we have hydrologists and drillers and a lot of local health departments and health districts who've requested these. They're available in English and in Spanish. Oh, I missed something here. And we left this space available where the yellow box is so you can put your own label on it. So you can hand these out with your URL and your phone number so that well owners can contact you directly. I mean, we're trying to promote what the work you do. It also obviously promotes us, but everything we do is free to everyone. It's a really great spot to be in, and we want to be a partner to anyone who wants to partner with us. So we're trying to be cognizant of that, if you will, and so it's available that way. It's also available in Spanish, and certain areas, especially near larger cities, there may be a lot of private well owners in certain parts of the community that are Spanish speaking or native Spanish speakers. And so, they're available in those too. And that's all we have been. And so this is from one of our newsletters. This is an older version, but we put this out a couple months ago. I think it's going to be open till April 1st. At the time, it had been 80,000 and now we're up to 93,000. And we are going to print more, probably after our private well conference at the end of May. And so, yeah, it's just something you can provide where you don't have to do anything but ask. You don't have to pay for it. You don't have to develop it. And you can look online under our resources page where you sign up for the newsletter, and you can see both sides and read it if it fits for what you're after or not. But let us know if you're interested. And they're bundled in 50s, I think. So, a lot of times we get someone asking for 250 English and 50 Spanish or something like that. Our hotline. And so to start out, it was going to be a well hotline, and we developed it into a lot more. We launched this last April. So the second button on our webpage is Visitor Help Center. Sally and Aaron both manage this. And so there's 3 ways to contact us. You can go to the phone number that's at the top. When you click on that, this is the page that comes up. You can search on your own, which we have a lot of well owners who do that. Tens of thousands have already. Or you can go to the chat bot, and if we're there, we can listen or maybe even answer. But it also will take everything we've ever done. We put all the transcripts in from all our webinars and all of our lessons, and then all of the videos we've ever done. And we put all those transcripts into a database that this chatbot only uses that. And the idea there is you're going to get consistent answers. So you can ask it a question. If it's the middle of the night, it's going to come up with an answer like, what should I test for? That's all in there, what we recommend. And so if I just say flood, for instance, this is the resources that come up. And these are all the articles that are in, there's about 150, I think, articles in there that all we've written. And it's all the basic questions and other things that have come up that we get asked more frequently. But if you do that, then it takes you to this video we developed on Is My Well Safe After a Flood and what to do. So yeah, and so we're gonna get to the questions. It's already almost 5 till 3. That's my fault. Yeah, we share a Google Doc. I'll get to that at the end. So if you've asked questions today, which looks like a few people have, we'll get to those at the end. Sorry, I used my mouse and I shouldn't have. So, okay. We find that our Department of Health or other state recommendations are a large driver for testing, yet health literacy issues are the largest barrier to installing treatment. What are some strategies we can use to bridge this gap? One, it's great that you've already identified that, and part of this also was wasn't going to fit on the slide, was that you've done a survey of your well owners, which is great. Hopefully what we've talked about already is giving you some ideas. And one thing I will say is installing treatment, the cost and understanding of the cost to maintain is really an issue. And there's not a great solution for that. What we learned from doing our survey is there was one group that had money set aside to pay for treatment equipment for the quote worst cases, where they were really a problem, had something really high that was really a health risk. We also had a study funded here by HUD to look at lead in homes with private wells, and it was a very large grant, and one of the things they included was to either add treatment or actually even replace pipes in people's homes. I think they replaced all the pipes in 5 people's homes, and then they added treatment equipment for lead and maybe another dozen. If there's a way to write that into some funding mechanism, or that's maybe where like a bank or a Rotary or some other group may be able to step in and provide some resources, and you can start a fund. And again, you have to be, I would say, you need to be really careful with those funds. But when you really have a hardship case, low income, underserved, all those things where there's no way they're going to be able to afford it, finding a benefactor is really the way to go there. I also want to mention that Minnesota Department of Health has this really good document on water treatment devices. It came out a year or two ago. I highlight it all the time, and I'm going to show it to you here because it really describes everything that's going on related to if you know your constituent or if someone's told you to add treatment, whether you really need it for that constituent. So it's called home water treatment. You can just Google that, MN home water treatment for Minnesota, and it'll come up. But it walks you through all the things you need to consider, and if treatment's even the right thing. It even talks about the certifiers, which is National Sanitation Foundation, Underwriters Labs, and the Water Quality Association Gold Seal. Those are third-party certifiers that a treatment company will pay them to independently test a treatment device, and it has to meet certain standards. Like for lead, it has to lower it below 10, let's say, ppb. I'm making that up. But you only want to get a treatment device that has one of those symbols on it, because otherwise you're going to find treatment equipment like for arsenic that's much cheaper, but it's because it hasn't been tested and you don't know for sure what you're getting. But it has all that kind of information, and then it's got these tables that show you for all these other issues, whether they be health issues or color, taste, and odor issues, what kinds of devices will work. You can just look at that table, and then when you get down to it, if you look at absorptive media for arsenic, it tells you what the initial cost is if it's point of use versus point of entry. So it's got a lot of good information that you as a professional can use to help a homeowner understand, even validate what you're recommending to them, or if you're a treatment person. Because there's sometimes treatment folks get a bad rap. They sell equipment that isn't needed, and that certainly happened, but that's every industry has bad salesmen, right? You can't really say it's an industry problem. And so anyway, if you're one of those folks that actually sells treatment equipment, then having something like this document to bring with you certainly gives you some validity with the homeowner, because I certainly have ran into a few folks who have several $1,000s of treatment equipment in their home, and when I asked them what they had in their water that they needed this, they're like, oh, we never tested. So which is unfortunate, because you don't know, maybe they did need it, but there was no testing done, or it was basic testing that wouldn't show they needed that kind of equipment in the first place. So you can, there's just a lot of different options. So yeah, I encourage you to take a look at that. Is there an effort to reach out specifically to well owners of wells installed before requiring that wells be locatable in a database? I see both the highest risk standpoints, those sorts of wells, and the lowest visibility of those wells and well owners. Well, certainly, most states didn't pass laws until at least the late 60s or early 70s, some much later than that. requiring a permit and a log be filed. 2 states obviously still don't do that. And so what we do, we look at all well owners, right? I mean, we don't specifically reach out to those that were installed before. We naturally find many of the problems are with wells that were before those rules. They weren't constructed properly. They're older hand dug wells, or, they're wells from the 50s and 60s that may not have been grouted, all those sorts of things. So, we mentioned this, and if you've been involved in any of our webinars, or if you haven't especially, you should join some of our other webinars, because we deal with a lot of these issues specifically. We're trying to teach homeowners about what type of well they have. Do they have a drilled well that's in bedrock or in sand and gravel? Or do they have a large diameter bored well or a dug well that was hand dug? What's that look like? Is there a log available? In the end, I didn't show this, but in other webinars, I talk about the 2 biggest issues aren't PFAS or any of the latest whatever, lead or whatever. It's well owner knowledge about how to take care of the well and what their risks are, and poor well construction. Most of the problems, and people don't call us if everything's running smoothly and fine. They call us after they've tested and had a problem, or if they're new to it and don't understand, and they're trying to figure out what's going on with their well, or what kind of well they have. And typically those end up being the wells that you say they're low visibility because they're older. So I really disagree about the visibility part, just because they tend to be more of the problems. And most of the time we're dealing with, I ask for pictures sometimes when someone email us. I'm like, can you send me a picture of that? And, they're older, vulnerable wells, are not understanding that, they're in karst geology, where it's very likely they're going to always have bacteria problems. That's just the way it is. But there's also a lot of other factors that play a role in any individual problem. And so, we have people who swear by sand points. They're not even allowed in most states anymore. And if you're not familiar, sand point is a well that you can basically pound in the ground with a sledgehammer, because you have sand at the surface and it's a shallow water table. And so you can get plenty of water just by pumping this 2-inch or smaller pipe that you pound in 15 feet down, because the water table in the well and the aquifer are only, the aquifer is at the surface, that's the sand. They're totally unprotected, and anything that spills anywhere in the area is going to run towards your well as soon as you turn on the pump and lower the water level there. And so they are very vulnerable and they're very risky. Okay, what are some tips, strategies to reach out to underserved communities, Hispanic, Hmong, rural Amish? So we've talked about that today to some degree. No matter the group, you're trying to, identifying that is obviously the most important issue to start with. But then it's still about finding out the most important issue to them. Do they understand their risk? All that sort of stuff that we talked about. But really, one of the strategies that works best is finding a community advocate or a champion that is respected in their community. That could, clergy, a local politician who's actually respected, or business leader, someone that the folks trust. That's where you get your doors open. It really is. And you have to convince that person first, and that time and effort that goes into that, in-person effort, being transparent, being willing to change, and a commitment to being there when they need you. So, we're fortunate that we have a large enough team that we can actually spend most of our time just doing this type of work. And I understand that's not everybody's situation, but it's really useful if you can be there when they need you, and take the time to get to know you. If they, I'm a social person for one thing, I'm from a rural area, that helps me a lot in some cases, but it's still about convincing them why you're there and being on the up and up, and there's not some ulterior motive. A lot of people don't trust people they don't know, especially from a university or government. So, retired, I've got some examples. A retired water operator, I worked out in an area where we were asked to do an aquifer assessment in an area where the town had lied to some of the rural people. And I might have already mentioned this, but a number of years later, after I'd made basically friends out there, and 2 people I send Christmas cards to. That's how much I worked out there for like 6 years straight. It's about 100 miles from here. And the retired water operator is one of the most respected people in town. And he and I became friends. And so I got a call from a university that wanted to test a new type of drilling device that would freeze a sample in place down in the ground so you can collect an in situ water sample. Really cool idea. They needed 3 acres of land on 3 properties in prime farm country in Illinois, because they know that area where I'd worked had a lot of arsenic. So what are the odds of getting a farmer to give up 3 acres of land for no money? We didn't have any funds for 2 years so they can make it an educational site and also test out this device. So I called Mel, who's a retired water operator who's now passed away. This has been almost 30 years ago. He had all 3 sites within 4 days. I would have still been trying to get those 3 sites today. And that's the truth. So we went into an area that was underserved. There was a food bank that was very popular there, very low income community. So we went to the food bank. That was the person that one of the other politicians had suggested. Everyone trusted these people. And so we went and convinced them that we wanted to sample wells and we're trying to do the right thing and would be there to answer questions. And they helped us get that job done. The FFA chapter, so there's a bunch of flooding in Illinois. This is a long time ago in the 90s. And we needed to sample a bunch of wells for coliform nitrate that had been flooded along the Illinois River and the Mississippi River. So I was a farm kid. I was pretty strong in our federal Future Farmers of America chapter at my high school. And so we wrote a proposal to use FFA chapters to go out and do all the sampling. These are high school kids. They get education out of it. We gave each chapter $500, I think. And then we did all the testing and we held several public meetings where people could come and ask questions. These are 5 very rural school districts with maybe a total of 12 or 1,400 kids in all 5 together. And we had over 1,000 samples because we were working with the FFA chapter. So it's understanding those groups. And, you know, the Farm Bureau Crop Association thing has nothing to do with private wells. It's about irrigation in Illinois. But when we try to talk to irrigators in Illinois about providing their water use, there's no necessary incentive for them to do that. But when the Farm Bureau or one of the crop associations we work with tell the farmers why it's in their best interests, then they work with us. And so it's understanding who has those people's ear as well. And that's where you need to try to go. Protecting well owners. There were 2 questions. So we had a set of questions that we looked at starting last week, and then we had a bunch that came in yesterday and the day before. So I'm not sure if the same person asked this or not, but basically, how do you protect private well owners? Well, I mean, there are a few rules out there. I mentioned New Jersey, and banks and mortgage companies require testing for a home loan and more. And slowly you're seeing programs get started. I know there's a grassroots effort in Massachusetts to create legislation that requires minimal testing of private wells. We'll see where that goes. It's not law yet, but they've made a pretty good dent and have a lot of people interested in helping with that. So the one thing to realize again is in the end, being a private well owner means you as the well owner are responsible, and helping the homeowner understand that hopefully will help them open up to learning more about their well and trying to be a good steward and understanding that, you know, we still have people who throw their spent pesticide cans down an old dug well because it's a hole in the ground. All that just, you know, they're risking contaminating other people's wells because it gets into the aquifer, all that sort of stuff. I think the real path is outreach and education. They are our best tools. And as slow as that may seem, it's really about educating our well owners. That's the best way, is to help them learn how to protect themselves. And if you think that's a bad answer, that's really the only answer that I know, honestly. And saying how to reach populations that don't normally attend, or how to speak to those populations that don't care, you know, that is an entire presentation. I've run across a bunch of people who just tell me to go take a hike. In the end, you know, there's a lot of people that do want your advice and do want to learn more about their well. I think I've really covered a lot of it. And the one thing I will say is, if you can even reach some of the people in an area, that word of mouth, that, oh yeah, that guy really came through for me when I asked him these questions, he even provided this or whatever, that's your best bet. and some people it may take 10 years. There's folks over where I mentioned Mel. There's folks over there who still don't like me, but you can't make everybody happy, and you're never gonna. So you can't look at it that way. One of the things we've done when we're working in our local area is send postcards because they're so much cheaper than sending out like a first class mailing. So what we did is said, we're going to have students come to your home to ask about your well in this rural area. It was 3 zip code areas in a rural area. So we sent out postcards saying that we're going to have this meeting at a town hall in this little town, and all 5 students would be there that are going to come to your door. And here's what we want to answer your questions. Well, if we wouldn't have sent the postcards and we just did it other ways, we'd have had 10 people there. We had 90, which to me was a huge win based on what I know of rural areas in Illinois, since I come from one. But those things all matter. At least you tried. We did the same thing with the FFA project. After the FFA students put it out in their school districts that they're going to do this testing, we offered a public meeting in the evening to anyone who wanted to come. We had a schoolroom full of well owners from the school districts. Some of them had kids, some didn't. I just totally vividly remember these 2 older farmers who were totally riding me the entire time I was talking and asking questions they were trying to really get at, because they just didn't trust me. And it was really an interesting turn of events. We have well logs dating back to the 1890s, as I mentioned, and I made some copies of some of the older well logs in that area, and I made a bunch of copies and sent them around, and people were looking at them in the crowd. And it turned out their grandfather was one of the people who had helped put some of those logs together back in the 1930s. So that switched on a dime and totally flipped. They were totally supportive after that. You just don't know what's going to happen until you're there, and you stay consistent and things work out. The pesticide test, oh yeah. So we had a project where we needed to sample a bunch of wells in one area with the same geology to look at vulnerability of wells to pesticides based on depth to aquifer and surface geology. And so if you have ever worked with farmers, what are the odds of me going to a farmhouse and talking to a farmer and getting them to let me take a sample of their well, knowing I was looking for the pesticides that they apply on their fields, and it was a non-point source pollution program? Not very good, you would think. I had 2 people out of 148 turn me down. And 1, because I relate as a farm kid, 2, because I explained to them with the right strategies on why they need to let me test. Because of their kids, their grandkids, folks that come to their house. Sure, you might not get sick on your well water. These are dug wells, all of them, by the way. But I had my own examples to go by from growing up on a dug well, and I managed to get everyone to agree, but 2 people who I couldn't get to come to the door out of 148. So it's not an easy thing, and you learn as you go. But yeah, that's what I recommend. This is the last question. I debated whether to even address this because it's such a hot topic, but I'm going to anyway because I know how I feel and I know what science says. So should people add fluoride to their well water? Well, there's really 2 separate issues to that question. The first is, if you aren't on a public or community water supply that adds fluoride, then you're not getting any. And so should I be getting more fluoride in other ways? And the answer to that is yes. There's indisputable, overwhelming evidence that adding fluoride to public water supplies provides significant dental protection for the general public. And that is not debatable. I don't care who you think you are. It is a fact. Yeah, any state health department has data on that and shows what happened since the 50s when they started doing this. The risk is fluoride, if you have too much of it, can also cause problems with your teeth. But that's why communities keep it around 0.7 parts per million, I think. And I'm not a fluoride expert, so, but I think that's right. And it's not a risk until it's over 3. That's not going to happen. The other part of that question, though, is should I get added fluoride for my family by adding fluoride to my well water? Absolutely not. Adding fluoride and even buying fluoride and a device to put it in your water system at the right rate, all that sort of stuff is beyond what the general public should try to consider to do. I mean, if you talk to your doctor and your dentist, what's the best way to add fluoride to your diet? They're probably going to tell you fluoride mouthwash, and I'm not I'm not a clinician, so this is just my opinion at this point. And if you're using fluoride toothpaste, that may be enough. I think there's also tablets you can take, especially for your kids. But again, that's a question for your doctor and your dentist. But I do not recommend anyone trying to add a fluoride device, treatment device that'll add fluoride into their water supply. I'm sure you can find that on the market, but I find that as a risk, especially because if you're adding too much, it could cause health issues with your teeth. But you need it. It's really an interesting thing. And the other side of that, I guess, is naturally, there are areas where there's natural fluoride that's dangerously high. We have an area in northern Illinois where the fluoride is 7 parts per million. And so they have to remove fluoride because it's not good to drink that from their water. So I'm going to skip this. There were a ton of other questions that have nothing to do with outreach strategies. There's probably 15 or 20 of those. And so I listed these here, and I'll come back to them, or I was if I had time. I'm already running behind, but we have questions, so I'm going to pop over this, make it full screen. Is that big enough? Can everybody read that? Sally, Aaron?
That looks great.
Okay. Do you know of any current grants that would help with outreach for wells and groundwater? You know, the only program I know that has really been out there for folks is for either counties or local health districts or states is through CDC. And we can get you more information on that, or you can go to their website. You know, right now, everything federally is in a state of flux. We wanted the person who runs that program to come to our private well program conference, and right now they can't even travel. So I think, you know, in another month, in theory, all the federal dollars are either going to be released or removed, and we'll all have a much clearer picture about what might be available. But in all honesty, from what I know of all that stuff, this is about the worst time to try to get funding. You know, we feel like we've developed a program that stands on its own, but we're not 100% clear we're going to have a program after this year. So I don't know of any other grants other than, you know, things that states may have, and I would start with your state health department. You know, foundations may be another option, but that's research I haven't done to know who might be interested, what foundations, private foundations may be interested in this work. So what is a gravel well? Well, so a well is finished in usually in an aquifer, right? It's the sand and gravel aquifer that's glacial or alluvial, which means it's along a riverbed. So some of the large rivers may have an area that's 10 or 15 miles wide. That's the bottom ground, if you will, around the river. Most of that's going to be sandy because when the glaciers melted, these huge torrents of water left sand. They're basically buried sandbars, and now they're full of water. So a sand and gravel well is glacial or alluvial, which means river laden sand and gravel. And in Illinois, we're glaciated most of the state. And so we don't have bedrock at the surface. We have sand and gravel and clays. In some cases, as much as 600 or 800 feet. In other places, maybe just 20 or 40 feet. But it's a sand and gravel layer that was left by a melting glacier. And the other type of well is a bedrock well, which would be, it's fractured bedrock. The difference, we have a webinar just on well types. You can go find that, or you can wait till we do the next one. But that's, If someone wants to find a career similar to yours, what background would you recommend, schooling and experience? Any programs you're familiar with that have a strong online public health communication program? I've been pretty far removed from this. We're a unique organization, but something like a USGS or a State Geological Survey, JOB, sometimes DNR. I know some counties have programs, like Wake County, North Carolina has their own groundwater program and private well program because they have so many private wells. They do amazing work for a county compared to, they probably have as good a funding as some states, to be honest. As far as the background, geology or engineering related to water would both be good. I'm an ag engineer as an undergrad and a civil engineer as a master's, but I'm not an engineer. I'm a hydrologist. And I say I'm a groundwater hydrologist instead of a geohydrologist or a hydrogeologist because the geology I know I learned on the job. I've had no formal geology training. So I don't call myself a hydrogeologist because I'm a groundwater hydrologist. I understand a lot about hydrology, and I work with groundwater. So, you know, depending on the job and where you fall in, most people today obviously don't stay in their jobs either, and I have, because I have a different job every couple of years. You know, we're doing different kinds of work. My ag engineering undergrad really prepared me for this, though, I will say that. But any kind of, even in ag, you know, some of the ag science or ag soils type careers lead to this, and we see a lot of extension folks who are working in water. You know, I mentioned Virginia Tech and Penn State and Texas A&M. They have funded groundwater private well programs. You know, the Texas Well Owner Network is a good place to look. But those are extension. So I mean, that's, you know, some of those folks are professors, some are academic professionals like I am, which means I don't have a PhD. And so, yeah, I don't teach at all. I'm at a university, but I don't teach. I just do research and service like this. So I fell into it. I loved it. Yeah. As far as the online public health communications program, I'd have to ask my staff. Some of them may have some better ideas. But if you email us, I'm sure we can look into it too. But I'm not familiar with any. I know we have a program at the U of I that's for public health. I don't think it's online. And my staff person who is just graduated from Columbia with a toxicology public health degree is out this week. So she may have some ideas. I know she's been looking up, she looked around before we hired her. Okay, what well class has a piping schematic focus for wells, either pressure switch or other pressure systems, variable speeds? Wow, you know, I don't know. And that's certainly not my strong point. You know, it's probably almost a plumbing type of thing. You know, Purdue has a plumbing house and through their civil engineering department, but I don't know. It's not necessarily about the engineering side of that. It's more about the water quality side. Yeah, I know there's a lot of, you know, I haven't done that. I had some of that in ag engineering, but just for reference, I was in college from 1982 to 1988, so it's been a little while, and I couldn't size a pump without going back to square one if I had to, probably, to be honest. So I can't help with that one, but we can probably look into it. Or I can ask somebody in ag engineering. I still have ties with our department, so if you are interested, again, email us. I can try to reach you there. Bentonite pellets have been associated with PFAS contamination of groundwater. I don't have any information about that, and I did not know that. What I do know is that you know, Nebraska did a drought study back in like 2006 maybe, and what came out of that was natural bentonite clay pellets, not the formed ones or slurry, are the best things to use for grouting a well, which is, you know, I've installed myself, I don't know, probably 60 monitoring wells, and we've always used natural bentonite pellets. And how that differs, I mean, if it's in the natural bentonite pellets that are mined from the ground, I'm not sure how they could have PFAS contamination unless it's in some process that's used whenever they're mining that. So I don't have any information. I would say Nebraska's Department of Health and Human Services, who did that drought study, would be a really good place to contact for that. Or like Baroid, although I'm not sure what they would tell you. So it would be interesting to make your private well assessment form an electronic, not just fillable form that automatically collects the data for you to analyze. So the PDF can be, well, the tablet form actually allows you to download a CSV of the results. But for what we're doing, this isn't a research study. We specifically had to provide information to EPA and OMB, the Office of Management and Budget, when we developed it, that it wasn't going to be, this information's private. And so the only people that see the results are the well owner and the RCAP person and our team that did it. I mean, we do store them, we have them, but they're not in a form that lends to that. But I'm not sure that you couldn't do that with the fillable PDF. My staff person that developed the fillable PDF, which took over a week to do, she would know how to download that. But once you fill it out, it should be, I think there's a way to take each of those and put in a value like in a CSV file. So it's not something we're looking at. It's not again, it's not a research study and we're not sharing the data. So does radon affect wells? Yes, there's radon in groundwater. I don't know a lot about it other than when it comes out of your tap, it volatilizes. There's EPA has a web page on it that they've archived, but it's still there. And according to that, because I've answered this question before, there are about 200 cases a year that are blamed on radon in water. I want to say that the majority are from drinking the water, and the like 70% and 30% are from inhalation from breathing it after when you've opened the tap. That's not very many cases. There's a lot more information out there that I don't know, but if you want that resource, you can probably find it on your own using a search, but I can certainly get that for you if you email us. What are some considerations for pouring a concrete slab around? Okay, so I didn't answer this question. I don't think it's a good idea. I thought about it a lot. I'm not sure. You know, what we recommend for proper well construction is that you mound the soil up around the well so that if there's you get a real gully washer of a storm, water's going to run away from the well and it's not a low spot where water's going to pond. Because even if you have it properly sealed and there's good grout and all that stuff, you still don't want water sitting around your well. And that's assuming it doesn't get overtopped. But I don't know. Yeah, and I'd have to see the well and what you plan to do. It's just, it doesn't make sense to, and this wasn't a slab, it said curb, I thought, in the original question. So that's a very different animal. You just need to make sure that it's still accessible, right, in the end. So if you're going to put it in a pump house, if it's a very deep well and it has a submersible pump, you need to be able to get a rig over it whenever your pump fails. So you need to consider those sorts of things. Yeah, I'd have to see some pictures to know what you're really talking about, I think. Yeah. I'm thinking, I'm sorry. I'm going to go on. How often should a homeowner test their well? So we have several webinars that discuss this, but you should test it for coliform and nitrate every year, and for inorganics and metals and anything that might be a contaminant of concern every, say, 3 to 5 years. And that depends. You really need to go look at our other webinars or wait until we do another one on like in a few months on the same topic, because it can vary where you're at in the country. I know I show this picture of Rhode Island where they actually have natural occurring beryllium, which I'd never even heard of beryllium being a regulated contaminant until I saw their website. But it has health effects. It's regulated under the Safe Drinking Water Act for community wells. And I would never recommend anyone anywhere else test for beryllium. But if you're in Rhode Island, you should. So there's a lot to it. This is not a simple question, but you need to do a little investigation and find out if there's anything going on in your area. Like, yeah, I've seen all these slides pop up in my head from some of the other presentations that I'm not going to go into now. This information is on our website under our videos. So, and if you want to contact me later, the one thing I will mention is that an hour or so from now or 2 hours from now, you're going to email saying thanks for attending, and it's going to be from my email address. So you will be able to contact me directly. Do you have a suggestion for a future training or video? We have a huge problem with well contractors not knowing how to locate a well using quarter correctly. I believe this causes some of the well databases to be incorrect since that information is used. It is a huge issue. We're switching to, the surveys here, the geo survey and the water survey chose probably 25, 30 years ago to use Lambert coordinates as a Lambert conformal system, which is just another method. But at the time, Esri products and GIS didn't convert automatically like they do today to lat long. There used to be a program that converted for you. It was called ArcLegal, and I don't believe it's available anymore, but we transcribed almost all of our well records from quarter section to Lambert using that. I do think training's the only way, because you know, even when we get coordinates from drillers. Every once in a while, the coordinate will show up in Alaska or in the middle of the Pacific Ocean, or you know, there's still someone writing that down, likely who's on a drill site, and I think training to help them understand how you can best use it is important, because yeah, it's going away, and really. I think our state health department has actually changed that and allows them just to put the Lambert or the you know, the actual lat long coordinates on it. But I think short of training, I don't know how to do this. You could try to make a video. I know we did that for irrigators when we were trying to get them to tell us where their well was. We made a short video that had them go to Google Maps and zoom in and click on the spot where their well is, and it gives you a coordinate at the bottom, and then send us that coordinate. Yeah, that's because we do find, you know, I had a study, we were trying to map where the bedrock surface was over several sets of glaciation. So the bedrock was 400 or 500 feet below land surface. And one well had the bedrock surface almost 60 feet lower than anywhere else. And it didn't make any sense. I didn't want to map it that way. I ended up calling the drilling company, and actually the driller still worked there. He remembered the well. He's like, oh, I said, this puts us down in the Mackinac River Valley. He goes, oh no, that's up on the bluff, which was 80 feet higher. He put section 3 instead of section 2 on the log. And so we had it in the wrong place in our database. And this happens a lot. I just had this happen with a small subdivision, 10 homes. They all showed up in a spot where there's no homes, and yet there's no wells where the 10 homes are, a mile south, wrong section. So yeah, there's certainly a need for that. Hopefully you have a venue that you can get to that would help with that, because otherwise getting drillers in for a training is a pretty tough road to hoe unless it's the middle of winter. You mentioned that many well owners reach out directly to you and that you try to respond to each of them. What do you think is a good ratio of number of well owners participating in an outreach program versus the number of specialists available to answer their questions? You know, that really depends on your funding and how many. I mean, you know, it's not like our audience is 23 million homes, and it could be any one of those that decide to call us, because when you search for us or go to the EPA's webpage on private wells, it takes you directly to us. You won't have those issues, and so I really don't know what to tell you there. You know, for some of the smaller studies we've done, like we had those five geology students go out to every home in 9 townships, 300 square miles or so. As a rural area, there were 1,700 wells. We probably got 5 or 6 calls at the end where people were asking a question about that. We did get 2 steel tapes stuck in those wells, even though they had no ends on them, which I had to pay a driller to pull pumps to get those out. So, I mean, yeah, that's here or there, but yeah, I don't have a good feel for that. It really depends on the type of problems, how knowledgeable the well owners are. There's a lot of things that go into that. You know, and so even for us, we have 2 people that are both, but it's part of their job. If the phone rings, we're answering it. Most people actually don't call us. They use the online services that are there, and that's greatly reduced the number of calls we get. So yeah, I don't think it'd be a lot. I mean, if you're, depending on the size of the area you're working in, I think the state of Illinois Department of Public Health has 1 person that really runs their outreach program, or it's not an outreach program, it's a permitting program. And the counties actually do the permitting, but there's a state lead at the Illinois Department of Health, and that's 1 person. So I don't know if that answered your question or not, but anyway. I'm sorry we went so long. I appreciate everyone that stayed. Yeah, thank you. And if you have any other questions, just let us know.